full written testimony will be included in the record, so please don't feel pressured to cover everything in 5 minutes. Finishing in less than 5 minutes may even earn you brownie points on this panel, and certainly will with the people that are coming up next behind you. We'll be using a timer to track the progress of each witness. When the light turns yellow, the witness will have 1 minute remaining to conclude his or her remarks. When the light blinks red, I'll have to ask the witness to stop. We'll hear from every witness on each panel before members will be provided an opportunity to ask questions. Because we have a full day ahead, I request that we try to keep things moving in order to stay on schedule and respect each other's time. And I'm sure, frankly, many of you probably have planes to catch as well, so we want to be sensitive to that. With that, I want to thank you again for being here today, and I'm happy to welcome you. When Ms. McCullum comes, I'll yield time for her at the end of whatever panel she arrives at so that we can have statements. And I also want to make a special point of thanking Chairman Calvert. We're operating on a very abbreviated schedule this year, and frankly, there was some thought that perhaps we wouldn't have public witness panels, but he felt, and certainly Ms. McCullum and I felt, this is a really important function for this committee. So you got the poor staff working overtime, and Congress isn't in session, but this committee certainly is. So that's how highly we think of you and the testimony and the point of view that each of you that are going to speak here have to present to us today. So with that, let me welcome our first panel. We've got Chief Baker of the Great Cherokee Nation of Oklahoma, Mickey Percy, the Executive Director of Self-Governance, the Choctaw Nation, Sarah Smallwood, the Director of Public Policy and Promise Zone Coordinator, also with the Choctaw Nation, and Cynthia Boone's with us from the Osage Mineral Council. So if we can, you know, we always give preference around here to Cherokees, Chief. So you're first up, and we'd love to hear whatever testimony you care to present.
Thank you, Chairman Cole. It is my honor and privilege, and OCO. I am Principal Chief Bill John Baker of the Cherokee Nation, America's largest federally recognized tribe with more than 330,000 tribal citizens across the country. During my time in office, I've worked hard to address the extreme health disparities that plague tribal communities in northeastern Oklahoma. Over the past 5 years, we have wisely invested more than $100 million of our business profits to build and renovate health clinics. These facilities will improve the health of our citizens. However, to truly serve our people, we needed a way to move forward on a major expansion of our aging and overcrowded hospital. Unfortunately, the IHS construction backlog would not allow for a speedy resolution to our problem. Rather than wait for IHS, we called on Congress to urge administration to receive new applications for a joint venture construction program. With the help of this subcommittee, earlier this month, the Cherokee Nation signed an historic joint venture agreement with IHS. This will dramatically increase the size of our medical campus and increase our delivery of services as the largest tribal health care system in Indian Country. Our story has made one thing clear. It's better for tribes to seek out bold solutions instead of idly waiting for a day that may never come. Under our agreement with IHS, Cherokee Nation will fund facility construction that will save the federal government valuable dollars. This is a monumental undertaking, and the Cherokee Nation will spend more than $150 million on 450,000 square feet new facility, which is the largest project ever approved by IHS. It will be twice as large as the next largest IHS joint venture facility. Upon the completion, in 3 short years, we will secure better and healthier lives for future generations. We also know that the dire need for facility construction and repair in Indian Country goes well beyond the healthcare sector. We applaud the subcommittee for focusing on the issue of BIE school construction for fiscal year 2016 Appropriations Bill. We urge you to continue the momentum by adding funding for fiscal year 2017. But let's be realistic about how far that funding will go. The schools that applied for education construction funds last year are in need of immediate repair and in some cases total replacement. BIE, however, is still working to complete a priority new solutions for school construction. Otherwise, we will never be able to address our needs in a timely fashion. One solution could be a BIE equivalent to IHS Joint Venture Construction Program. The Cherokee Nation operates Sequoia High School, a BIE-funded school with focus on academic success. Last year, Sequoia ranked 4th nationally in the number of Gates Millennium Scholars per capita. Our youth excel in spite of aging and inadequate facilities. Campus-wide plumbing problems have led to significant mold deposits, and the discovery of asbestos led to a temporary closure of dormitories and decreased enrollment. Like many BIE schools, Sequoia requires immediate assistance. The need throughout Indian Country is immense, but so is the cost to replace many of these facilities. Only 10 BIE schools were selected to apply for funding. Sequoia was not one of the schools picked, and considering the huge backlog, we are not likely to be anytime soon. This is why we must embrace innovative answers. What if tribes were able to incur construction costs for these facilities in exchange for fixed operating and maintenance costs? We could begin to alleviate the backlog and create new educational opportunities in Indian Country. If we wait for BIE to slowly work through the list, we'll be in the same place year after year. We urge the subcommittee to consider new solutions to the problem of school construction. One clearly possible is a new joint venture-like program for BIE. The consequences of waiting are too high. Our children's education are at stake. Thank you for granting me the opportunity to testify before you today, and what of.
Chief, and right on time. Perfect timing. So, as he set the bar high for you, Mickey. So we'll move to you next.
I wanted brownie points.
You got them. You got them.
You had 2 seconds left. I've never. Thank you. And again, my name's Mickey Piercy. Oh, turn my thing on. My name's Mickey Piercy, Executive Director of Self-Governance, Choctaw Nation of Oklahoma. We're privileged and proud to be here. We always are. Greetings from Chief Gary Batten, Chief of the Choctaw Nation. We are the 3rd largest tribe in the nation. And again, we're going to double team you here, but with the stuff I've got, we'll go fairly quickly. I can't go any further without saying I have Carmelita Skeeter in back of me, and she runs the Tulsa Indian Resource Center, and let you know Choctaws do support urban health. So is that okay, Carmelita?
Thank you.
Okay. And moving, always have, and we have, all the tribes have many tribal members living in the urban areas, and urban health is important. You have my written testimony. I'll speak to several things. I won't speak to joint venture as the chief did in a few minutes, but one thing, this subcommittee protects us from sequestration, unilateral rescissions, and other cuts. Please continue to be vigilant, and when the term sequestrations come and the rescissions, protect us from those dollars leave and they never come back. So that is an issue. So that is a high priority. We do support the President's 17 budget, special diabetes program, continue the support, raise if possible. Contract support costs, we appreciate the 100% funding that Congress has made available to us. There are still issues with contract support. There always will be. That's administrative cost, so it's always going to be questionable. We're finding these days with the tribes, we're dealing with the, excuse me, not necessarily with the agency, but with the general counsel within the agency. And so that settlement issues with BIA and the Indian Health Service has created some issues with contract support costs. It will continue to be one. We continue to ask for your support with contract support costs. We do think we have a policy that's going to go forward. Purchased and referred care, the old contract health service. We would appreciate more and more funding Thank you, sir. With contract health, keep in mind, we have found, and I know the feeling of most of the members of the Committee on Medicaid Expansion, those states that have accepted Medicaid expansion and move forward, and there's less need on those states than there are on those like Oklahoma who have not embraced Medicaid expansion. So it's still extremely important. Real quickly on the joint venture, because we were, with the Cherokees, there were, I think, 3 initially that were approved for 17 on the joint venture program. We are moving forward with ours. In fact, steel is up. We're having a topping out ceremony soon. And it is the best way and the only way that tribes can really move forward with construction and bringing about new facilities. You'll never get one off the list, as the chief mentioned. But there are issues with the joint venture. One thing I would suggest, as the chief mentioned, increasing the scope of your joint ventures to small ambulatory clinics. There is a legislative area where you can fund small ambulatory clinics. Add a staffing package to that would be very helpful. Our problem we're running into at Choctaw is the fact that we will be in January 17. Ours is 144,000 square foot, so it's smaller, but also has the only outpatient surgery clinic in IHS or the tribes. Our issue is we will be in January 17. The money that's been appropriate or set aside for us with IHS is only $12 million. We plan on being in before that. It's a new clinic, so we got 294 staff, docs, nurses, all the staff. We're going to have to fund those until what's called a beneficial occupancy thing in the appropriations language. That's construction language. That doesn't have anything to do with providing services to people. So we're asking you we're working with IHS. Please work with IHS to allow them to assist in funding for those additional 2 months to allow us to hire, train, put people to work. That was pretty good, huh?
Very good.
It's 2 in a row. They're putting the bar up for you, but
Sarah Jane will never meet that.
we're delighted to recognize you for your testimony, Sarah Smallwood, and glad you're here. So you're recognized.
All right. Well, thank you, Mickey, for that lead-in right there.
I'm trying to help.
Helito, Mr. Cole, members of the subcommittee, thank you so much for having me here today. My name is Sarah Jane Smallwood, and I grew up within the Choctaw Nation Promise Zone in its poorest county, Pushmataha County. I'm here to make a very important request today that will give real promise to America's Promise Zones. The Choctaw Nation Promise Zone is the only Promise Zone administered currently by a tribal nation. On behalf of my chief, the Honorable Gary Batten, I'm here today to testify on the Choctaw Nation's accomplishments, challenges, and our recommendation for the Promise Zone Initiative. Our nation encompasses almost 12,000 square miles. In January 2014, all of our 10.5 counties fell into USDA's extremely high poverty designation. 20% of adults had less than a 12th grade education, and 15% lacked basic literacy skills. We're using the Promise Zone designation to combat these statistics by partnering with hundreds of local, municipal, educational, business, and other partners all around southeastern Oklahoma. Our goal is to move southeastern Oklahoma forward. For example, some of these partnerships have included a $15 million grant partnering with local Head Starts and child care providers. This improves access to high-quality early child care education and early child care provision for low-income infants and toddlers. Another example is our Connect Home initiative with HUD. We were selected as a pilot site in July of last year, and this connects children in our public housing units to low-cost, high-quality internet service. By the end of the one-year designation, by July of this year, we will have all Choctaw students in public housing connected to internet service. We have worked diligently with our partners to implement the Promise Zone initiative and empower our communities, but we still face challenges. These challenges are also mirrored by the other Promise Zones all around the country, not tribal and non-tribal. First is the lack of agency participation. no funding is specifically appropriated to PromoZone designees. PromoZones are given preference points in only a handful of competitive grant programs. In 2015, only 13 federal agencies gave preference to 42 competitive grant programs. This is only 2.5% of all federal grant competitions. 2.5%. Further, most federal agencies, especially those that have a lasting impact on PromoZones, have not been involved as lead agencies. We have serious obstacles in meeting our environmental and cultural needs of our PromoZone, especially within our vast geographic area. This requires the collaboration of all federal agencies, especially those that have a lasting impact on Indian country. Second is the lack of training and consistent implementation across the federal government. I would like to commend USDA for their leadership, and especially our USDA liaison, Ms. Hewat. They've worked hard to help us expand PromoZone preference, even within USDA, and even within the USDA Rural Development Agency. For example, Choctaw Nation was the original code talkers in World War I. Our language is an important piece of our history, culture, and education. We cover nearly 12,000 square miles, and distance learning is vital to continue this education. Last year, we applied for a distance learning grant, and we didn't get it. This grant also did not include PromoZone Priority, even though it was housed within one of the PromoZone lead agencies. However, we worked with Hewat and her colleagues at USDA, and this year's application includes PromoZone Priority. However, to do this across the federal government, I need thousands of employees like Hewat, and so do the other zones. There are hundreds of programs that are important to PromoZones, and they should be included in the program. But they aren't, and they can't be, because a lot of the federal authorizing language precludes preference points. So the bill language we are asking you to adopt today would allow preference points for all 20 PromoZones in competitive grants, technical assistance, and other capacity building opportunities. This would provide clarity and consistency across all zones. We've been working with the other PromoZones for 2 years. We've shared our experience, concerns, and our best practices. And in the last week, I've spoken with most of them, and they share our concerns. We all need this language. Today, your committee has a very unique opportunity to make the PromoZone initiative better serve some of America's most poor, most structurally distressed, and neediest communities. Your efforts will give real promise to America's PromoZones. Y'all cookie.
Thank you very much. That's 3 in a row. That's pretty good.
I have to say, she was in the red.
Well,
Come on, Mickey.
Not being critical.
that's because you were talking at the beginning of her testimony.
It could be.
Yeah, she got started a little bit late.
Didn't want to give her too much credit.
Okay. Gosh, nobody's harder on Choctaws than Choctaws.
I know, right?
Cynthia Boone, representing the Mineral Council, the Osage Nation, is here. It's good to have you here today, and you're recognized for your comments.
Good morning, Mr. Chairman and members of the subcommittee. My name is Cynthia Boone, and I am a member of the Osage Minerals Council. Thank you for the opportunity to testify. The Osage Minerals Council is made up of 8 members elected by the Osage Inuitants. The Osage Nation Constitution and the 1906 Congressional Act provides the Council with the authority to administer, develop, and protect the Osage Minerals Estate. The Osage Minerals Council has a unique role in all of Indian country. Our role goes back to the discovery of oil on our reservation in the 1890s, more than 100 years ago, and even before the allotment of our reservation in 1906. As you know, under allotment, Congress divided up Indian lands and provided small parcels to individual members of a tribe. In our case, Congress allotted the surface lands, but not the minerals. Instead, Congress reserved our entire minerals estate for the benefit of all of our Osage members on the tribal rolls at that time. Congress called us headright owners. Each headright owner had 1 share of royalty from the production of oil and gas in the Osage Minerals Estate. The Osage Minerals Estate has been producing oil since 1896, making it one of the oldest fields in the United States. Our minerals estate contains proven reserves. In 2015, it was estimated that our headright owners would receive about $13.6 billion in royalties from 2012 to 2027. That's about $1 billion a year. Despite our success, the Osage Minerals Council faces many of the same challenges as other energy-producing tribes. We also face some challenges that are unique just to the Osage. First, like other tribes, energy production on our lands is limited by a lack of staff, expertise, and resources in the BIA's Osage Agency Office. Without the BIA staff or expertise to keep up with the energy industry, we are not able to fully utilize our resources to benefit our Osage headright owners. For example, we estimate that the BIA averages more than a year to approve a simple workover permit. As you might know, a workover permit only approves maintenance for an existing oil or gas well. You can imagine the delays for permitting a new well. The BIA needs far more than the $5.9 million requested in the President's budget to manage the oil and gas development at Osage and across Indian country. The BIA needs, 10 times this amount. When you compare the BIA's budget to the $187 million requested for the BLM, it's no wonder that the Government Accounting Office recently found that the BIA management hinders Indian energy development and needs sweeping changes. Second, unlike other tribes, the 1906 Osage Allotment Acts create special legal requirements for leasing on our lands. For example, leasing on the Osage Minerals Estate is especially excluded from the Indian Mineral Leasing Act. Instead, the Interior follows Osage-specific regulations, and the BIA is the only agency involved in approving oil and gas permits in our minerals estate. The BIA does not get any help from the BLM or the Office of Natural Resources Revenue like other Indian reservations. The Osage Minerals Council also has unique responsibilities, but our funding is limited as well. We currently manage the estate with an annual drawdown from royalties that should be distributed to the headright owners. This is an unfair burden on the headright owners and is not enough funding for effective management of the estate. Meanwhile, every year since 1921, the state of Oklahoma has collected a gross production tax from our royalties. This tax generated in excess of $5 million for the state, with no benefit to the Osage headright owners. With this impact from state taxes and many responsibilities for managing the Osage Minerals Estate, we respectfully request that the subcommittee provide direct funding to the Osage Minerals Council to hire the staff we need to manage and promote drilling and production. We need about $4 million in funding to employ experienced staff, to create a digital database to monitor well production, environmental hazards, and lease productivity, and to plug abandoned wells. Just as an example, the BIA has identified roughly 1,400 wells for plugging. Each of these wells costs between $10,000 to $100,000 to properly plug and abandon and remediate. Even worse, the BIA has not complied with the environmental reviews for years. This subjects the United States, the Osage Minerals Council, and the Osage lessees to never-ending litigation and kills the development of our new wells. We need to turn this situation around. Oil and gas production in the Osage Mineral Estate supports thousands of jobs and provides badly needed economic development. We respectfully request that you increase the BIA's natural energy budget, and we request $4 million in direct funding for the Osage Minerals Council so that we can effectively manage the Osage Minerals Estate for the benefit of the headright owners and the entire region. Thank you for the opportunity to testify.
You're way ahead, so.
I get extra brownie
You
points,
get extra
right?
brownie points. Let me first, though, go to our ranking member, Ms. McCollum, if you had any opening remarks you'd care to make.
No, Mr. Chair, I apologize for being a little late. I had the ambassador from Laos in my office, and I have a very large Hmong population, and the president's going to be visiting there in September, so I apologize for being a few minutes late. But I took lots of notes, again. So, and I think some of this is going to be conversations we're going to have. So BLM has nothing, I was asking the staff when you were testifying, BLM has nothing to do with anything that you do, it's just BIA.
Right.
Okay. Okay. Thank you. Thank you, Mr. Chair.
Well, thank you, and you certainly don't have to apologize. Like I explained before you got here, if it weren't for you, we wouldn't be having this hearing. So thank you for weighing in. Thank you for being here. Chief, let me go first to you, if I may. And I was actually advised during your testimony that 10 or 15 years ago, we did have some sort of joint venture program for BIA, which I was unaware of. And I have no idea as to why we stopped doing that, because it's been so successful for us in the healthcare area. Are you aware of that at all, or had you heard that?
I got the same footnote that you got when I walked in. I got the same footnote that you got, that it 10, 15 years ago that it was in existence. I was not aware of it either.
Yeah, we will take a look to see what happened. And, honestly, maybe 10 or 15 years ago, quite frankly, I know certainly my tribe, Chickasaws, wouldn't have been in a position to take advantage of the joint venture program that we, like you, and Choctaws have used in the healthcare area. And so it may have just withered away, but we have more tribes that have the ability to do that. And there's something to be said if that will expedite. It won't solve the problem. As you know, there are many tribes that don't have the ability, but we ought to help those that do, and that lets us concentrate what dollars we do have in other areas.
And we have the ability and the appetite.
That's great. I want to go to you next, Ms. Smallwood. I'm not skipping over you, Mickey. I'll be back. But just
a hard question.
yeah, well, I'm very interested in what you had to say about the Promise Zone, because I know initially I had a discussion with Chief Batten about it, and this was just after it happened, and they were having difficulty accessing any of the programs. I mean, it seemed for a while, and I know the intent behind it by the administration was to do something good. I didn't realize it was this narrow in terms of the number of grants and agencies that actually participate in the program.
Yes, sir. I think when it first came about, no one was quite sure what the Promise Zone would mean, but we had the promise, and we got to work.
On?
Yes, it is.
Okay, good.
I'm kind of short, so I'll pull it up here. But kind of short. But, we have many great partners in southeastern Oklahoma, and the leadership of Choctaw Nation really brings together our municipal partners, our county partners, our schools, our community action agencies. So we have a great team that has really gotten to work to put the Promise Zone to our best advantage. However, it also requires a lot of time from us here in D.C. to tell our story. A lot of the focus on the Promise Zone has been on urban areas as well. And so to tell our story, to say we're serving 12,000 square miles, however, the Los Angeles Promise Zone has the same number of people in about 2 square miles. So it's really hard to tell our story to federal agencies to understand why the implementation of the Promise Zone is different and should be different for rural and tribal zones. But we have great colleagues working with Promise Zones around the country. We've been able to visit Minneapolis, Los Angeles, Kentucky, and others. And we really have a lot of the same concerns. So we've been bringing our Promise Zone colleagues together, and I think it really is making a difference. But right now they have the staff in place, and we want to make sure that it continues beyond this fiscal year. But also opens additional doors to bring other agencies on board and to effectively serve the promise of these communities.
I want to commend you while we've got Choctaws on the panel. I've had the opportunity to go to your language center, which is really unique. They actually wire up. They have native speakers, and they're wired into dozens of schools in the area. So literally, you teleteach effectively, and they use the public school system throughout their area to preserve and advance the language. So it's and I think you even have it taught in the University of Paris or something, teaches Choctaw. So it's pretty amazing setup. I was amazed you didn't get help with that.
We have an application pending this year, but I wanted to say thank you to the committee for your support of Indian education in Choctaw Nation and your visit to visit our BIE school at Jones Academy and to visit the language school. It's so important to have members of Congress there for the kids to realize this really is important. But
I actually went,
we appreciate
after
it.
I saw the language center, called up Governor Anatop and said, you need to go look at this thing. We need one of these ourselves. But it's impressive. Cynthia, let me go to you real quickly as well, because this problem you touch on is true all across Indian country with various tribes that are energy producers. We hear this concern about both the level of staffing and, frankly, the difficulty, particularly during a boom period, of maintaining staff, because literally private companies will come and hire them away. So we've had this discussion with the Department of Interior on several occasions. But the amount of, the length of time it takes to get anything done compared to things that are outside. I've even talked to companies that were drilling in the Dakotas, and they would say, we drill right up to the edge of Indian land because we can get our permits processed very quickly, a matter of weeks and a few $100s. The minute we cross this line, it's a year and it's thousands of dollars. And so we literally have a lot of resources that aren't developed very well. That's, in some senses, an authorizing problem as well as an appropriations problem as to whether or not we should do this. Let me ask you this question, and would it make sense to, obviously with appropriate funding, but to essentially put the Osage in charge of their own mineral estate, and they would make the decision in terms of who drilled and what the regulations were and what have you? I know this is always a controversial subject in Oklahoma because it gets you into, are you going to have a checkerboard of different regulatory schemes? But I'd like to have your opinion if you have one on that.
I believe that would be something that we would consider is taking over the leasing and the environmental, and that's why we would like to have our own staff. What we were at one time called a one-stop shop, and what we would like to do is return to that. And by doing that, we could speed up this process so that the Bureau of Indian Affairs would just have to rubber stamp whatever we had to submit.
We've done something like that in other areas in landowning where basically the tribes gets to, instead of every decision having to go to the Interior, the Bureau of Indian Affairs, or really the Department of Interior, approves the regulatory scheme, and then the tribes operate the scheme. And that may be something we need to look at in Indian country.
And certainly we would be open to look at that ourselves.
Thank you. I want to go to the ranking member and let her ask whatever question she cares to.
Ms. Smallwood, one of the things that, as you pointed out, there's promise zones in the Twin City area, and we're constantly fighting and competing for dollars too. So it's the whole program short of dollars for capacity and demand for it. But you were talking about some authorization that would need to happen, and so we run into things here working with the authorizing committees not moving forward. Could you maybe elaborate a little more on what kind of conversations you've had with the authorizers? Because sometimes we'll have a good idea, and sometimes it's our own colleagues, and rightly so, on the Appropriations Committee who will stand up and say, you know, this isn't authorized. The authorizers need to do their job. So could you just maybe paint the picture in a little fuller on what you see some of the challenges with authorization?
Definitely. This is our first stop to come to Congress to share this story. We've been meeting with all of the agency folks for about 2.5 years now, and I can't speak for the agencies, but it seems like they would appreciate a little bit more flexibility to more fully implement the promise zone and to implement that preference. But every time we identify different grants and targets of goals for not only us at the nation, but for our local partners, they say, hey, we need legislative language to enable us to do this. And so they said, you know, we're a bit hesitant. We can't do this. We've got to have clear direction from Congress that we can fully implement the promise zone throughout every single different part of our department and across the federal government. So we came to you guys today to start that conversation. So we started with the Appropriations Committee first to say FY17 is going to be a big year. We're just getting our feet under us. Choctaw Nation and others have had the luxury of 2.5 years of having the designation, but there's a third round of promise zones that will be announced probably later this spring, and that'll be the final round. So I can only imagine, their kind of nervousness about tackling this ginormous program and trying to leverage the whole width of the federal government. So we're really trying to connect those other zones and share our experiences, and would appreciate any connections and conversations too that you guys can help us with authorizing committees. But this is our first stop to start that conversation and to see what other conversations we need to have related to appropriations and authorizations.
Thank you. And Principal Chief Baker, thank you for your comments on what we need to be looking at with healthcare, but also your talking about joint ventures with schools, and I think we're going to go back on, as Chairman Cole said, look what worked and what didn't work. But we need to jumpstart this, and if some of the tribal nations are willing to stand up and be partners in it, we shouldn't say no. But there will be a concern with some of the just as we're talking about doing joint ventures for small clinics, there will be some concern in some of the tribal nations about, do we go to the back of the list again because we don't have anything? So I think anything we move forward will have to be done in consultation with all the nations coming together and helping us, or else it could become a divisive issue. And you're the perfect people to start that conversation. So thank you for being here today.
Well, I want to thank our panel. We're already a little bit behind, so forgive us for that, but that's usually my fault on these days, as it is once again. Yes, sir, Chief. Oh, were you just waving? Okay. I thought you'd picked your finger up. So you all are excused, and if I can, I'll invite our next panel. Thank you very much again for your testimony. If we could, Chief Floyd, Principal Chief Muskogee Creek Nation, Vernon Miller, Chairman of the Omaha Tribe of Nebraska and Iowa, Victoria, and forgive me on the names, is it Kitchian? Keon. Treasurer of the Winnebago Tribe of Nebraska, and Floyd Azure, Chairman of, I'm not going to try that. Thank you. Come on up.
Thank you, sir.
Thank you. Mickey, good to see you again. Mickey, grab your name tag.
You can use it.
No.
Wait a minute, I gotta get a hug from Chief. Huh?
Never can reach.
I'll leave it.
That's all right. I'll get in touch with you.
Okay, if we can, we'll go ahead and get started, and we'll, if we can, Chief Floyd, we'll start with you for whatever comments you care to make, then we'll work down the line, and then we'll be open for questions.
Thank you, Mr. Chairman.
Thank you.
Appreciate the opportunity this morning to, thank you. Appreciate the opportunity this morning to appear before you and provide some oral statements. I did, for the record, submit written statements, and the topics that I'd like to speak about this morning are specifically for healthcare. In terms of my background, as you know, I was just recently elected as Principal Chief of the Muskogee Creek Nation. Prior to that, I held a senior executive service position for 23 years in both the Indian Health Service and the Department of Veterans Affairs and Veterans Health Administration. So, you know, I kind of come with expertise in that area, and so we are completing written remarks on the Bureau of Indian Affairs section of the Appropriations, so we'll be submitting them soon. So I only have about 3 or 4 points I'd like to raise that I think are very pertinent to our operations of our tribal health program, and we do operate 3 hospitals and 8 outpatient clinics, and so we have a pretty extensive healthcare system for their 80,000 plus citizens. The issues that I see, well, first of all, let me say that the National Indian Health Board has done extensive work on analyzing the budget for fiscal year 17, and I fully support what they've said, and I'm sure they've submitted it for the record, and I would just want to reiterate that you know, fully funding the budget at I think $299 billion over 12 years is the goal to set. Specifically for us, I think that in addition to fully funding that, as you know, the state of Oklahoma does not receive Medicaid money, and I know that there's initiatives, one called the 51st State, excuse me, for Medicaid, or the 1115A waiver. We are seeing a trend, a decreasing trend in third-party revenue that I believe is kind of a dangerous trend and slope to be seen. And it requires that the tribe now step in with tribal funds to support the healthcare system, which we will again take up next week, and it's becoming, you know, multi-million dollars to make up that gap. I do support, and I think the tribe supports direct agreements with Medicaid to tribes, so that we can, you know, more that we can have the ability to directly bill and receive Medicaid funds. I know the state is one of 19 that's chosen not to do so, and I think we're suffering the consequences there. And so I hope that the committee can take up the fact that, something needs to be done, not only in the state of Oklahoma, but the other 18 states that have Indian tribes that are also experiencing the same thing that we are. Secondly, I think that the topic that I see that is substantial but seems to be hidden is the use of electronic health records. Having come to the VA where you have a very comprehensive inpatient, outpatient record, and I know that there's been efforts jointly between the Indian Health Service and the VA, the fact that we rely upon private packages is very expensive. The package that the Muskogee Creek Nation currently uses, we feel has cost us in excess of $23 million in collections due to its inability to interface with the signed record so that we can code it and bill it properly. And so as a tribe, we'll probably be seeking legal recourse with them. But I think as we go forward, I think that particularly if I can refer just to the Department of Veterans Affairs and their Veterans Lifetime Electronic Record that they are renewing, I think it would be very productive for the committee to consider the Indian Health Service and the VA taking this matter up. Since the Veterans Package is a public domain similar to what the Indian Health Service uses, I think it would be money well spent if we can get to that single type of record format and save us the expense. I know that within our tribe, we have full-time employees that just have to manage the use of the record on a daily basis. And that in itself is at least $300,000 that we're spending to support the package that we're paying them to deliver to us. We may not be alone. I've talked to other executives in the healthcare with other nations and in the private sector, and they struggle as well. But I think for us, knowing that it's costing us $23 million is significant when, in a $300 million program that we operate. So I wanted to just make sure that that point wasn't lost in the discussion and consideration of the 2017 budget. Also would like to just point out that the Muskogee Creek Nation has initiated a respite care program. As you know, taking care of the elderly is part of our tradition, and we do, I think, a very good job of that within the tribe. But it also brings stress within the households. And so we've initiated a program where we can either bring people in on a short-term basis to relieve those people who are caring for their loved ones, or to come in and help clean the house and just take care of the household, and so that the caregivers can have a short break. And I think this worked out very well for us. I haven't really checked the admissions and readmission data to see on the long run if that's preventing people from coming into the hospitals. But I think it's a program that's worked well for us and may serve as a model for other tribes. And so I ask the committee to at least consider even a pilot project on respite care.
We're at the 5 minutes.
So I appreciate the opportunity to appear this morning, and be glad to answer any questions later, sir. Thank you.
Again, your full testimony will be entered into the record as well, so thank you,
sir.
Chief. Chief Miller, you're recognized for 5 minutes.
Thank you. Good morning. Well, my name is Vernon Miller, and I'm chairman of the Omaha Tribe of Nebraska. And just for some background information on my tribe, we're located in northeast Nebraska and northwest Iowa is where our reservation boundaries currently lie. We are in a Supreme Court with the state of Nebraska. They want to reduce the size of our reservation, exclude one of the towns. So that's kind of been something controversial you may have heard about at the Supreme Court level. So that's something that we're dealing with, not only from a tribal level, but a statewide level and now a national level. And so that's something that's of note is what I wanted to bring to your attention. Our reservation is currently, hopefully remains, 307 square miles throughout the Nebraska-Iowa area. Unfortunately, we have an unemployment rate of 69% compared to the state unemployment rate of 2.5%. That's significant because President Obama recently visited Nebraska after a State of the Union, and he wanted to specifically go to Nebraska because of the low unemployment rate. Unfortunately, in my community, there's a huge disparity there, and so I wanted to bring that to your attention because that really is an issue that has is as a tribe that we're dealing with, and we reached out to the governor of Nebraska, and we've had conversations, but we realize as a sovereign nation that is our issue to tackle, and that's why I come here today to talk about some of the obstacles that we have with our funding levels, and I've been here a couple years before, and so I won't go into detail in regards to my remarks because I've submitted those to you, but I will touch briefly on a couple of points I wanted to bring up. Generally, I did want to make a comment in regards to I also serve on TPIC, the Tribal Interior Budget Council, and one of the mechanisms that we have to formulate our budget on is we're forced to prioritize. And unfortunately, what that does is that forces me as a tribal leader and the rest of my council to really say, okay, this program is prioritized over this program this year on funding cycles. And what we would like to recommend is that we move to a needs-based format. That would allow us to really properly assess the programs that we have and understand, from a programmatic level, what's really our need in our community at the time for that fiscal year and moving forward. I wanted to briefly touch on, from the law enforcement, public safety, and justice side. We really do have some concerns with the current grants that we're receiving. We do have a Department of Justice grant that really helps us and be able to subsidize some of those lost revenues. But from an example I will provide you is that from a tribal court perspective, we don't even have enough funding to provide for a bailiff, as well as from the law and order side, providing a criminal investigator to really properly, adequately address some of the crimes that are going on. Not that they're at a level that's of deep concern, but just being able to properly and adequately address those issues. We had an assessment done a few months ago by the BIA, Great Plains office, and it came down, and after their assessment, our facility itself is really outdated. From the design of it, isn't adequate and isn't up to date at all. And so that's a concern of ours that, with an aggressive prosecutor this year, our courts and our facilities, kind of bursting right now. And so to really adequately address those needs of our community detention facility, to alleviate some of that overcrowding would be appreciated. From an education standpoint, in Nebraska, we have public schools. We don't have BIE schools, but we do have several of our students who do go to the BIE schools in South Dakota and Oklahoma, to Riverside, as well as in South Dakota to Flander. As well as some of our students from my tribe specifically, we do have students that go to Haskell, which is the higher ed program that's provided, as well as SIPI. Behind me is my sister, who is on spring break, and she's a student at Haskell Internations University. And I wanted to just bring that to light, because visiting her and taking her to college, I do see, the benefits of having a university that specifically is culturally relevant and engaging of higher education issues. And as a former educator, it brings me joy to see, students that can succeed in an environment that really focuses on Indigenous issues and Indigenous perspective on education issues. And so visiting that school, I do know recently there has been some improvements, and I'm very excited about that, to see our students be able to prosper in that environment. But there is a need there. I've been there, and their classrooms are outdated. There's a lot of technology issues, the housing issues. It'd be great to have more students go there, but that's often a barrier, as it is kind of a remote and rural area of Kansas too, and also being able to have our students go down there. So from the education issue, I just want to bring those issues to light. And from a welfare issue, I just wanted to touch on how our welfare assistance, we're being inundated, by our tribe members. We have over almost 7,000 tribe members who come to us, and are able to meet some needs. And so we try to help. On average, we're getting $30,000 a month in requests. And so to continually fund that would be appreciated. I wanted to go ahead and just thank you for your time. And I also just want to remind you that I did submit my full testimony, and then I will honor that time and say thank you again for your diligence here, as well as your commitment to us in providing that.
Well, thank you, and thanks for traveling such a long way to be with us and present your testimony. Victoria, we'll go to you next, if we may.
Good morning, Chairman and members of the committee. My name is Victoria Kitchion, and I'm a Winnebago tribal member and serve as the treasurer of the Tribal Council. I want to thank you for this opportunity to come before this committee, and I'd like to speak on the still ongoing health crisis at the Winnebago IHS hospital, and the crisis that has led to the IHS operated facility to lose its Medicare and Medicaid funding. And I guess I'd just like to note that there has been progress, but much work is still to be done, and I'm calling on your subcommittee to help us see through those efforts and make some real concrete pressure to oversee this process and tie the solutions to the receipt of that funding to continue those services for the Native tribes that facility serves. It's about a 13-bed inpatient emergency room IHS facility in northeastern Nebraska. It serves the Winnebago, Omaha, Ponca, Santee Sioux, amongst many other Native Americans living in the area who use that. Collectively, about 10,000 patients use that. It's all we have. It's all our reservation counts on for the healthcare and livelihood of our tribal members. And it'd be impossible to cover all the deficiencies identified by CMS, but I'd like to, briefly touch on some of the more horrendous cases which led to that termination of certification. And many of the things that I'm going to point out are not unique to Winnebago, and that's the unfortunate case, is that these healthcare disparities are across the Great Plains area as well as Indian country. And as back as 2007, the Winnebago Hospital has been operating with deficiencies, and they just have been yet to be corrected, yet we continue to receive funding to provide the same poor service. So, they are so egregious. We're not talking about outdated equipment. We're talking about nurses who don't know how to administer dopamine, a crash cart that is missing pieces. Nobody knows how to use it. A nurse that can't call a code blue. These are life-threatening states that our patients are in, and the nurses and the ER cannot accommodate these patients. I'd rather call them victims than patients, because that's what it's come to. And most importantly, CMS identified up to 4, 5 unnecessary deaths. So it's troubling for the tribal leaders to have to support the families and tell them that it's getting better, we're working on it, when time and time again we get the same answers from our area office. So these deficiencies are numerous and life-threatening, and as I said, last July we were terminated, our certification was terminated. And a quick synopsis is, back as 2011, there was a recertification survey, and at that time there were 9 areas identified, the ER and nursing most notably. And at that time, my wonderful Aunt Deborah, she was a victim of the deficiencies and died at the hands of those federal employees. She was left unsupervised, over-medicated, and essentially overdosed at the hands of IHS employees. In addition to my aunt's case, there are many others during that year, suicidal patients who were released without care, patients who were not properly assessed to determine if an emergency existed, and people just plain being turned away for care. Undocumented things in the electronic medical file, people being sent home undiagnosed with Tylenol and later to be life-flighted and dying. It's just terrible. 2011, some of these findings were identified. 2012, they became public, and IHS Director Rubido publicly promised that there would be improvements, but as you can see now, it's 2016 and it's only gotten worse. This is why the oversight of this committee is so important. In the past 2 years, we had 4 additional deaths, some of them of tribal member, 35 years old dying of cardiac arrest, 17-year-old. These are young people that are dying. But most importantly, Chairman and members of the committee, it's tragic. And we have all lost someone at some point, and it's really sad to find that it's a federally run facility with these conditions. So in the interim, I guess I'm asking for your assistance, because we can't have the lack of services determine the quality of care that we get at this facility. We have our referred care dollars that these people are being diverted, and so how are we going to pay for this? Or how are we going to pay for these additional costs that we're incurring in fiscal year 16 and 17? We can't lose services or staff members, because as it is, we operate underfunded. We don't have the providers to collect that third-party billing. We're just really in a state of emergency as far as healthcare, and we can't lose another Native American to this situation.
Thank you. We'll be back in the question and answer period to the issue you raised, because it's a very important issue, and it does have the attention of this committee, I can assure you. If we can, we'll go next to you, Mr. Azure, is that?
Floyd Azure.
Azure?
Thank you.
Okay, thank you.
My name is Floyd Azure. I'm chairman of the Assiniboine and Sioux Tribes of the Fort Peck Indian Reservation, which, pardon me? Start all over. My name is Floyd Azure. I am chairman of the Assiniboine and Sioux Tribes of the Fort Peck Indian Reservation. It's a 2 million acre reservation, and we're 350 miles from the nearest major medical facility. I would like to thank the subcommittee for inviting me to testify on behalf of the Fort Peck tribes. Congress has long recognized that the foundations for economic development and prosperity in Indian country lay in community stability, which begins with infrastructure such as safe drinking water, roads, and utilities. This is why we strongly support the administration's $2.262 million request for the operation and maintenance funding for the Fort Peck Reservation rural water system. This funding is essential for this system to operate, which now provides drinking water to more than 15,000 residents in northeast Montana and several social and governmental agencies, including the Bureau of Indian Affairs Agency Office, Poplar Schools, and Poplar Hospital. Related to our water infrastructure is our transportation infrastructure. The administration's funding request for the road maintenance program is insufficient. This year, the request will be to permit the tribes to maintain only 16% of BIA-owned roads and 60% of BIA-owned bridges in acceptable condition. This is a safety issue. Most of these routes are gravel and earth and school bus routes that require more frequent maintenance than paved roads. We urge the committee to add an additional $9 million to the road maintenance program. Doing so will increase the percentage of BIA-owned roads and bridges maintained to an acceptable condition. As we seek to build and maintain our physical infrastructure, we need to better enhance our community infrastructure, including our law enforcement department, our social services programs, and our tribal courts. This is why we support the President's Generation Indigenous Initiative as a comprehensive interagency response to the challenges facing Indian country. There is no greater need in Indian country than public safety and justice, and these programs cannot be sacrificed for any purpose. Our police chief estimates that 70 to 80% of criminal conduct has a drug component to it, with assaults and burglaries arising out of the drug use and addiction. The BIA's own statistics are alarming. Over a 5-year period, drug-related arrests in Indian country increased nearly tenfold, from 443 arrests in fiscal year 2008 to 4,289 arrests in fiscal year 2013. Our tribal police department has 18 police officers, 2 dedicated to drug enforcement, 3 criminal investigators, and we share dispatchers with Roosevelt County. The needs of our community and those throughout Indian country cry out for increased law enforcement and justice funding. The IHS operates 2 clinics on the reservation, the Vernie E. Gibbs IHS Health Center in Poplar and the Chief Redstone IHS Health Center in Wolf Point. Inpatient services are available at the non-IHS Poplar Community Hospital and Trinity Hospital in Wolf Point. To combat the high incidence of heart disease, cancer, and diabetes, the tribe supplement health services on the reservation through our health promotion and disease prevention wellness program, which we operate pursuant to the ISDA contract with IHS. The tribe's focus on preventative care is the reason we so strongly support the requested increase of $48 million for purchase and referred care. This level of funding will allow more service units to move beyond life or limb coverage and provide a fuller range of health care services instead of crisis care. Everyone agrees that focusing on health of a person instead of crisis care will improve the health status of our people. One area I would ask the committee to address is in its reports is that for many of our people who have insurance, service unit at Fort Peck will not refer people out for anything but life or limb care. Thus, even if someone has insurance to cover a procedure like a knee surgery, the person's primary provider, who is the service unit, will not refer him out. If the person gets the knee surgery anyway, the IHS will not pay the copay or the deductible because it does not meet the life or limb criteria. Many of our tribal members who have insurance are the working poor. They cannot pay these obligations, which are oftentimes substantial. Thus, this bill is referred to collection. To me, this is bad policy, and let me explain why. My other career outside of being chair of one of the largest land-based tribes in the country is auto body repair. I repair cars at all time, and what I know is that it is always easier and cheaper to fix something early rather than to wait for it to get really bad. What IHS is essentially saying is that They will only pay for the copay and the deductible if a windshield is shattered and has to be completely replaced, instead of paying for a portion of the cost to fill in the chipped windshield. This does not make good economic or health care sense. This policy must be examined. My wife is a school teacher of 25 years. She just had an interaction with her students. She teaches kindergarten. The question was, what do you find in a hospital on a reservation? Dead people. That's something I'd like you to think about. And I'd like to thank you for this opportunity for me to testify.
Well, thank you, and we do think about it a lot. This committee's actually, and we know it's not enough, but we have actually increased the IHS budget by about 54% since 2008. It's been a steady, continuous effort, but we know there's still a long, long way to go, and your experience is proof positive of that. You should know we did raise this in this committee directly with the then director of IHS. I think there's been a change there since then, and I'm not applying a connection. I don't know, but I know there's different personnel there now. And I did raise it directly with Secretary Burwell, Secretary of Health and Human Services. She's got a task force team focused on this, and it's pretty embarrassing to us. As you know, you're not the only facility that lost certification by CMS. We had one on Rosebud as well. Very similar types of situation. One thing I would ask, and I would never recommend this. This is always an individual tribal decision. But we did ask IHS officials, could you see a difference in quality between tribally run facilities and your own? And they said, yeah, in some cases, because literally nobody takes care of your own people like your own people. I know that's what we did in the Chickasaw Nation beginning in the 70s. And it made the system much more responsive because, frankly, if you were sitting there waiting for 4 hours and we had that kind of problem, they'd just get on the phone and call a tribal legislator or something, and they got a pretty quick response. And over time, a lot of those staff became our folks as well. So, again, it's just something that would always be your decision, and it's no excuse for the Indian Healthcare Service not providing adequate care. And different tribes, it may make sense, it may not make sense. But I would just commend you to think about it at least and see if that helps. In the meantime, I will assure you that we'll be doing everything we can to push from this end on a bipartisan basis to make sure that those facilities are brought up to standard. We know they can't afford to be closed. There's no health care for many miles in every direction other than that facility. So, but what you're talking about is not acceptable. So I wanted to make that point. I'll yield to my friend, the gentlelady from Minnesota.
Thank you, and I want to reflect what Mr. Cole said when we talked about this a little bit yesterday. I mean, what is happening in the Great Plains, what's happening in hospitals in Indian country is not acceptable. And one of the first hospitals I visited was going through some restructuring and changing. This wasn't in the Great Plains area, and they had taken the maternity care out of there because mothers and babies were being lost. And then I went to a revamped clinic. It was really nice. And later that day, I went into a facility that I wanted to walk up and tell everybody to leave. So I'm sorry about your loss, your personal loss, and I'm sorry for all the families who've lost loved ones. So we're very serious about the oversight. One thing that's come up is the medical records. It started coming up yesterday. So you do not use the RPMS at your facility. Is that correct, Mr. Floyd?
That's correct. We don't use RPMS. We use commercial product.
And your choice not to use RPMS, which is delivered from the Indian Health Service, is that correct?
That's correct, yes.
And it's because it's inadequate, out of date, and doesn't work.
That's correct. I think the support, it's a MUMPS-based language system, and MUMPS programmers are, my age or older now, and they've retired, left the system, so you're really in a second generation, and so that's the biggest issue I see.
So we're talking about that now. I think that this has come up, so staff will be digging into it.
That's great, thank you.
Mr. Miller, we heard about how great Haskell was, and so I want to thank you for your comments on that. But I've been to Fort Peck My grandfather was a mechanic at Sydney Ford in Montana. And I know what it's like being from Minnesota, but also in the area of driving for dialysis. I read your full testimony. If you could just take a second, and you're looking for more dialysis, how far, even on your reservation, do people have to drive? And when you have a whiteout, you're not going to get in your car and drive. So could you just tell us a little more about what you've requested for your dialysis and how long that request has been in?
That request has been in for as long as I've been on the council. We have a situation where we have around 36 patients that they have to service in our dialysis, and they're not all Native Americans. There's non-Indians in there also, and we're pretty much paying for the whole thing. I think the closest one we have to us is in Malta, which is like 136 miles away. Other than that, there's none in Sydney or Glasgow or Williston.
Yeah.
We're basically the ones that do it, and I think after that is Billings, which is 350 miles away. So, and we need to expand, because right now with the situation we have, our dialysis workers are working 3 shifts, 7 days a week.
Thank you. I know that we want to work on preventing diabetes. We want to see what we can do to have better drug support for those individuals that have it. But in the meantime, dialysis is a life-saving treatment. And it's only going to, in my opinion, Mr. Chair, get worse. So we need to get a handle on this. And I say this is coming from someone from the Twin Cities who spent a lot of time in rural areas, especially in the winter. Patients just decide not to do it anymore. They literally decide to end their lives quietly because of the stress on the family getting them there, and as sometimes dangerous conditions that they put other people at risk in the winter to get them to dialysis. So thank you for including all of your testimony and having that in there, sir. Thank you.
Thank you.
We want to thank all of you for coming and testify, and we will be addressing these concerns, particularly yours, as we go forward. And if I could, we're running a little behind. I'm going to invite the next panel up. But again, thank all of you for coming such a long way. Thank you for your testimony, both written and verbal. Okay, if we could next have Chairwoman Pearson, Chairman Flying Hawk, and Councilman Spotted Bear. Love to have you guys come forward, all of you. Good to see you.
Sir, are you? Good morning.
Good morning. Welcome. Well, thank all of you for being here. It's a pleasure to have you this morning. Thanks for traveling such a long way to educate us about your concerns. And if we can, Chairwoman Pearson, I'll start with you, and you have 5 minutes, and we'll move through the line, and we'll have questions.
Good morning, Chairman Cole and members of the subcommittee, and I appreciate this opportunity to come here to give my testimony. I'm not going to read the whole thing because I'm trying to earn brownie points.
You were here early.
Yeah,
You've
I was
already
here,
got the routine down.
but I would like to, echo a little bit of what the other tribes have been talking about, the other council people. We do have our problems, which are in law enforcement. We're 49% funded there, and our law enforcement is quite small for our enrolled members. And our enrolled members, we have approximately 7,250 enrolled members, of which 6,200 live on the reservation. And so our law enforcement is currently at 6 police officers, and that isn't enough to serve the number of people that we have. People are quite vicious when it comes to, trying to avoid law enforcement. And what they have been doing is like calling in something from one end of the reservation when they know they're at the other end. So then those officers have to prioritize. But when they get to that other end, there's nothing there. So that's kind of something that, the people have gotten pretty keen to. But on the same note, we've got the drug problem. And I'm not saying it's only the meth and, prescription drugs or anything. It's getting a little more serious where lately, I believe the last 4 to 6 people that have passed on our reservation, and it's been due to drugs. Each one of our reservations needs a facility, a treatment facility to help us combat this. And those are hard to come by because I do understand you're going to have people that are qualified to work in those facilities and treat the people. This past week I have 2 nieces that are both college graduates and never lived on a reservation. They had to come home to bury their father who died from a drug overdose. And it's not here in my testimony, but these are true facts that we deal with on our reservations. I wish I can always come here to give testimony on the success we've had and things that are going good and everything, but I can't do that. Another issue is our court system is they're underfunded, they're understaffed, and it's a busy place. But the one thing that concerns me right now is the security. That we don't have any security in our administration building or our courthouse. And recently we were, there was a threat made on our tribal judge. And they were told that, that it was going to be a bloodbath when they came in. But it was a non-enrolled member, a non-native member, in fact. So we had to pull in the sheriff and everybody, that outside our jurisdiction to come and help, protect the staff and the employees. I did let some of the employees go for the day, and then we just locked the rest of the place down, kind of, had a lot of officers. The one thing we did do, we had a drug sweep on a reservation about, I believe that was in December. There was 26 arrests made, which is not enough arrests, but people were taken off our reservation. And then about 2-3 weeks ago, we held a meth summit, and that was in conjunction with Cheyenne River, and Chairman Frazier from the Great Plains asked me if I would host that, and I did, and the turnout was, phenomenal. I give a lot of credit to our youth because a majority of our attendance was the youth. We have 3 public schools on our reservation, and from those schools, 7th through 12th grade attended that meth summit. And one school turned around and asked us if they could come and meet as their youth student government, meet with our tribal council and discuss these issues. And the youth themselves are the ones that brought up the fact that, what are we going to do about the meth? We know. So my answer to that is we better do something, because if we don't, the youth are going to think that they have, we're not going to do nothing. It's okay for them to use drugs. So I think right there, that's going to, we're going to do something for them and make sure that, they get what they ask for, because they're going to be our future leaders. I hear that a lot, but I want to do something about that. And with your help, and anything I can get, I'd sure appreciate that, because those youth are the future of our tribes. Everything is in my testimony here. I have, more, but I'd appreciate anything that you can help me with, and I thank you for this opportunity. Thank you.
Thank you so much again for traveling such a long way and being with us today. If we can, Chairman Flying Hawk, we'll go to you next.
Pijamando. De na ku hiana was stedo. translation is good morning to you, and thank you for this opportunity. I am here from the Yankton tribe. My name is Robert Fleinhawk, the chairman of the Business and Claims Committee of the tribe, and also recognized as the leader of the tribe. Also a member of our health board of the Great Plains area, and a member of the tribal task force from the CDC. But we are a Ihangtwa, the Yankton tribe, a strong and resilient tribe. I'm here to reiterate, to say again, the things that have been said over and over again, talking about the economy of us as a tribe and as a part of the Great Plains tribes. We are looking for help. Without this help, it affects our social abilities. That has been shared. You've heard earlier the challenges that we have in education and in a paper that was signed that's recognized as a treaty that the health, welfare, education of us as people are to be taken care of. Today we are challenged with that education. The committee and the people here have done great things, but yet we are still asking for that help. We have come short. We are told that we're given this dollar, and then we are told again that with this dollar you are to pay at least 80% of that dollar for things that we are charging again. So those are the things that we are looking at. One of the things that we have is the word consultation, and regarding this dollar, this budget, the committee is asking us, well, we have this consultation, but yet at this consultation we are presented with a budget that has already been set. So we appreciate the efforts and the work that's being done, but we need to really review that, relook at that process, that consultation. And I understand that we are looking at next year's budget and the year after that, but we've got to get a hold of that, slow that down, rein that in so that we can really have that consultation, so that we can really have some input on what's happening to us today. The drug has been really devastating to us. The health and the hospitals, the staff that are in those clinics, those hospitals. At home, our emergency care was taken away because of that dollar shortage. An ambulance is very hard to get into our clinic, but those are the challenges, and we are a strong people. We are resilient. We have been coming through these years historically as we begin, reaching out that hand and saying, here, welcome. And then what has happened to us today as that welcome has walked across this country, and we understand and still reach out to our neighbors, and we have a strength as we look up above us, and as we stand on this ground, we have this foundation, and then as we reach out to each other as fellow human beings to live together and to continue to be a strong community. So we are asking, as the Yankton people, the Ihangtwa people, to revisit this budget. We feel that at home and as a member of the Great Plains, there is a shortage. This dollar that is presented is used up. It is already used up by the demands that are put on it before it's even given. So, thank you.
Thank you very much. And if we can, Councilman Spotted Bear, we'll go to you next.
Okay, good morning, Mr.
Morning.
Chairman, committee members. My name is Corey Spotted Bear, and I'm a member of the Tribal Business Council of the Manda and Hidatsa Arikara Nation. I'm here today representing our chairman, Mark Fox, and the great people of the MHA Nation. I'd like to thank you for this opportunity. I'd like to focus on 3 priorities of the MHA Nation: energy, irrigation, and taxation, and I'll try to get to all 3 of those. Our Fort Berthold Reservation sits in the middle of the Bakken Oil Formation. We are still the 2nd highest oil-producing area in the United States. Even with declining oil prices in 2015, production on our reservation increased to 74 million barrels of oil and 78 billion cubic feet of gas. Managing this development and protecting our reservation is our top priority. Right now, the best chance we have for getting BIA the staff, expertise, and resources it needs to manage Indian energy development is to support the BIA's Indian Energy Service Center. The Service Center will be centrally located in Denver, Colorado. The center will bring together most of the agencies involved in Indian energy development and will recruit skilled staff to help improve energy permitting at the local BIA agency offices. In fiscal year 16, the subcommittee provided $4.5 million in funding to establish the service center. We greatly appreciate the subcommittee's support. Since this funding was provided, BIA has been making plans for establishing the service center, hiring staff, and assigning jobs. Energy-producing tribes meet regularly with BIA to plan for the new service center. Unfortunately, BIA did not request additional funds for fiscal year 17 to get the service center up and running. We asked the subcommittee provide the funding needed. The service center will need about $13 million over the next 2 years. The success or failure of the service center depends on its ability to hire enough staff to meet demand. BIA has gone without energy staff for too long. It is time to provide the resources needed to promote and support Indian energy development. The benefit from Indian energy development far outweigh the benefits of energy development on federal public lands. Energy development in Indian country provides jobs, funds our government, supports tribal infrastructure, self-determination, and waves of economic development that benefit entire regions. Even with these far-reaching benefits, BIA's conventional energy budget is a tiny fraction of BLM's conventional energy budget, about 3%, as you can see on the chart. How can BIA support and promote Indian energy development on a $5.9 million budget? It can't. And as you can see by the chart that we've provided, BIA and Fish and Wildlife Service have about the same energy budget. This is unacceptable. $13 million for the service center is nothing compared to the BLM's $187 million conventional budget. We ask that you provide this funding so that we can work together to bring Indian energy development into the 21st century. We also ask that you support a Fort Berthold irrigation project. This project was promised to us more than 60 years ago when our prime agricultural lands were flooded by the Garrison Dam Reservoir as a part of the Pix-Loan flood control program on the Missouri River and the hydroelectricity that it provides. The dam took more than 156,000 acres in the heart of our reservation. It flooded our best lands, hunting grounds, schools, hospitals, and roads. And if you talk to our elders about that, there's nothing more delicate than that situation. 90% of our members were forced to relocate to higher ground where our old people used to say nothing grows. We were promised compensation and projects to make us whole again. One of those projects was an irrigation project that has never been built. Before the flood, we had a successful agricultural economy. Before the flood, our people did not suffer from diabetes like we do now. The flooding of our lands entirely changed our way of life. We are here today to ask humbly the subcommittee to make good on that promise and provide the funding for a Fort Berthold irrigation project. Our engineers have done a feasibility study and found that the project will increase the diversity of crops, our yields per acre, and our return on investment. The project will cost about $60 million. We ask that you work with your colleagues on the Appropriations Committee to direct $60 million from the Western Area Power Administration hydropower revenues for this project. Our lands were flooded to generate the hydropower that they sell. This hydropower should pay for the irrigation project we were all promised. And as I conclude, I'd like to say a word about state taxation of Indian energy resources. To help address the shortage of BIA energy staff and funding, Congress should support eliminating dual taxation of our resources by the states. In the past 8 years, North Dakota has taken about $1 billion in taxes from the development of our energy resources, yet very little of this comes back to our reservation. Without the full value of our resources and the tax revenues that every other government relies on, our government cannot achieve self-determination, and we remain increasingly dependent upon federal appropriations. Thank you for the opportunity to testify today.
Thank you, and I want to start actually with what you had to say, because I think you raised a very good point. I've seen this again and again in Indian country, where states take a lot of money on taxing mineral resources, and they build no roads. You know, they don't fund the local schools. They don't, have the obligations on an Indian reservation that they have on non-reservation land, and they don't put the resources there.
Right.
And that, I don't know what the legality of that is. I know if it were gaming revenue, there's a compacting arrangement, and the state gets something, but it's something you work. In a case like this, I know there have been discussions between the tribe and the state before. They've just simply not been responsive to, somehow sharing the wealth that frankly is on your land and that you've generated.
Right. Mr. Chairman, when our tribe decided to mine this resource, it was with the idea to raise our standard of living. Everybody in here this morning, you heard, talked about substandard living conditions, but with having to share one half of our taxes, we're only trying to stay afloat and keep up with the negative effects of an oil boom. We can't raise our standard of living. We have a $128 million roads budget, but we can only afford to appropriate $20 million a year. A huge shortfall.
Again, I don't know what the situation is in North Dakota, and it's not for me to judge, but I know in Oklahoma we had not the same sort of situation, but we can have trust land all over most of the state. Different tribes can we don't have reservations anymore, but you can put land in a trust within your own reservation, and we had the ability not to charge state taxes on gasoline, and we sat down with the state and negotiated an arrangement where some of that tax dollars, if we agreed to charge it, would have to flow back to tribal treasuries where they could use it for tribal road construction. We limited it to governmental purposes. It had to be healthcare, education, or some sort of infrastructure program. It couldn't go back and be distributed. Is that a practical thing, or has that been attempted in North Carolina where revenue off of energy is concerned?
North Dakota?
North Dakota, I'm sorry.
If I can I refer? I know you're here to speak to me, but can I refer it to my colleague?
Chairman, just real briefly.
It's Raleigh Wilson.
Oh, sure.
Mr. Wilson.
Okay.
Thank you, Councilman Spaulding.
Yeah.
Mr. Chairman,
Just identify yourself quickly so this is not referred.
my name is Raleigh Wilson. I'm an attorney for the Mandan Hidatsa Ricro Nation. Thank you, members of the committee. Just real briefly, there is a Supreme Court opinion from the 1980s based on an old 1938 Indian Mineral Leasing Act, in which the Supreme Court found that Congress had not fully reserved all of the benefits from mineral resources for Indian country. And so the Supreme Court did their balancing and found that the Congress hadn't closed the door on it, and so states could tax energy resources developed on Indian lands, energy trust resources. And that's forced tribes like the Mandan Hidatsa and Ricro Nation. Thank you, Jason. That's forced tribes like the Mandan Hidatsa and Ricro Nation into tax agreements with the states. The states, they don't have to negotiate because the law, the Supreme Court opinion benefits them. And so in this case, the tribe has ended up giving a majority of its revenues to the state, who just recently unilaterally broke that agreement by lowering the tax rate as the price of oil has gone down, and they're trying to continue to develop oil, which has an impact on the Mandan Hidatsa Ricro Nation's budget.
And that's the Cotton Petroleum Court case.
Yes, thank you.
Yeah, thank you. That's a question I had. I refer to my friend from Minnesota for any questions she has.
Well, thank you very much, and to my neighbors to the west. I've had the opportunity to be in North Dakota and South Dakota quite a bit on some of the reservations. That you have my full attention, as always, and will add my voice to the representation that you have, because you have one representative here apiece. And so we work together as a 5-state area, and you have my commitment to take the things that you've shared with us. Especially, I think is important what you shared about Yankton. We hear the bigger reservations have their challenges, but when you start looking at formula distributions and that, you point out in your testimony how that leaves sometimes just crumbs for some of the smaller reservations, and we have to relook at that and reprioritize things moving forward. So thank you for traveling. Thank you for your testimony.
Thank you.
Thank all of you for being here. We appreciate it. I appreciate both your verbal and written testimony. And if we can, we'll move next to President Steele, President Carlson, and Chairwoman Jones. Hi, good to have you. Welcome. It's great to have all of you here. Again, thank you for traveling such a long way to share your concerns and to educate us about your conditions. If we could, we'll start President Steele with you, and then we'll work down, and we'll be ready for questions. President Steele?
Thank you, Congressman Cole. First, I'd like to thank yourself, Congressman Cole, Congressman McCollum, for visiting the Great Plains in past years to understand firsthand our conditions out there so that you could help. And I want to thank you for sending your staff people here just recently, Mr. Darren Benjamin and Mr. Joe Carlisle, to get an update on those conditions that our people are living in. I'd like to take time to thank you right now for your intervention in the Bureau of Indian Affairs, Bureau of Indian Education reorganization, which we disagree with. I personally say that I don't see where the BIE is addressing the GAO report from, when was that, about a year and a half, or 2.5 years ago, that says that there are teaching Native American children at the lowest level in the United States. And this was on CNN. It was in the New York Times. They've got all these statistics of the dropout rates, the reading levels, math levels, and I don't see them addressing in any form. They're going with this restructuring. The conditions that you put on them, we agree very much with. And so thank you for that. And I am the president of the Oglala Sioux Tribe and also the chairman of the Great Plains Tribal Chairmen's Association. The presidents, I gave testimony up here. So I've got their written testimony to review. But I'd like to address possibly 4 different areas of healthcare, law enforcement, suicide, and road maintenance. And in our healthcare, I did hear that you are aware of CMS and the Winnebago's, Rosebud, and also Pine Ridge is on the verge. We're on probation right now with them. That Senator Thune had the Indian Affairs Committee shake up IHS so hard all the top people fell out. And even our service unit director, our area director, and the HHS has put some extra monies down into Pine Ridge and Rosebud that we appreciate, and more personnel. We got the conservation, what is it, the Civil Service Corps with their khaki uniforms on down there now, and we're expecting to get better health care. We, Congressman Cole and Congresswoman McCollum, worked with the state, and it was a win-win situation if South Dakota went with the Medicaid expansion. But Medicaid did not come out with an interpretation of the law. Too late. The South Dakota legislature ran out of legislating days. So we didn't get it through there. But we are going to continue to work with them because Medicaid did come out on, I believe it was February 26th, with an interpretation that they give 100% funding to off-reservation facilities that Indian Health Service has a contract with. Now, we don't know how we're going to implement this. We're going to work with the state because it has to do with the state Medicaid plan also. And I've got a good relationship with Governor Dugard to see how we can implement this to supplement Indian Health Service in better health care for that individual. I see up in North Dakota, where they did go with Medicaid expansion, that this gave Indian Health Service more referred health care dollars because Medicaid was picking up 100% of those eligible Medicaid participants. And so they used to have a priority like us, of only priority one being sent out, which was life or limb. And now I understand North Dakota has priority 1s, 2s, 3s, and 4s that they can send out. And so I've got some expectations here, and we met with Indian Health Service earlier this week to work with us and to work with the state of South Dakota, who I very much appreciate working with. But still, we want to affect the where our life expectancy is 50 years at Pine Ridge, whereas the rest of America it's 80 years. And so I would like to affect that. We've got the Minneweechoni Water Project that is going to give our people a healthier life in the future. Our water is very contaminated with radiation, arsenic, and nitrates, that we're expecting a healthier person in the future, be less costly to the United States government because we have a treaty obligation. You did ask Chairman Flying Hawk why we didn't go what we call self-governance or do health care stuff. Now the Oglalas, we probably would make it. The IHS and BIA divided their services and their offices up into what they call tribal shares. The Oglalas, we'd take about a third of that area office, and what would we leave Yankton, Mr. Flying Hawk, Lower Brule, Crow Creek, Flandreau, Winnebagos, Omahas? I don't know if they'd be able to make it without the Oglala shares being there to help them. And so, if we're going to go in that direction, there's two things I want to watch. Is right now we have a treaty with the United States government, and that treaty healthcare is so vital to us. I do not want any individual in these United States to take us to court in the future saying we voluntarily gave up that treaty right by going self-governance and taking that responsibility to ourselves. And so that's one of the things I would like to protect, sir. I know self-governance is that, trust responsibility, but to me that's not like a treaty obligation.
Well, we'll have this dialogue when we get through with the testimony, because I remember us having a discussion very similar to this when I was at Pine Ridge, and I certainly respect your point of view on this.
I'd like to do it uniquely, sir, because tribes are talking about taking the health care and dealing with Avera or Sanford or somebody like that. But I'd like to do it in a way where we all do it together.
Well, let's hold the discussion, because I want to give the other folks an opportunity to present their testimony as well, but we'll return to this. President Carlson, you're next up. You're recognized.
Good morning. Thank you, Mr. Chairman and honorable committee members, for this opportunity to provide testimony on behalf of the Intertribal Buffalo Council. I'm Irvin Carlson, a member of the Blackfeet Tribe in Montana and president of the Intertribal Buffalo Council, an organization of 60 tribes organized to restore buffalo to tribal lands. Historically, buffalo were critical to the survival of American Indians. Tribal reliance on buffalo created a long, strong spiritual and cultural connection that was nearly destroyed with the mid-1800 census slaughter of the buffalo. This slaughter was a major part of the tragic history of the American Indian. Today, tribes strive to restore buffalo to Indian lands, to restore the spiritual and cultural connection, to reintroduce buffalo into the diets of tribal people, and to allow tribes that so desire an opportunity to utilize buffalo for economic efforts. Most importantly, buffalo restoration signifies a healing of historical trauma. The United States has provided ITBC funding since 1992, when the organization had a dozen member tribes, initially through earmarks and most recently through administrative action. Currently, the 60-member tribes of ITBC manage 52 herds, but the funding level for tribal herd development grants has remained stagnant since 2007. Our membership grows every year. ITBC is requesting an increase in funding for herd development grants from the current $1 million to a total of $3.5 million. ITBC collectively manages approximately 20,000 buffalo on tribal lands. The current level of funding falls extremely short of tribal needs to sustain restored herds. A total of $3.5 million for herd development grants to tribes will create jobs, allow additional restoration efforts, and adequately maintain existing herds. This increase will provide all ITBC member tribes approximately $65,000 each, which will enhance the growing tribal buffalo industry and allow economic development. And the 65 is even just far below, that's what tribes actually need. ITBC has long-term partnerships with National Park Service and the Fish and Wildlife Service on buffalo management efforts that include population management. ITBC accepts surplus buffalo from national parks for distribution to tribes and also has agreed to accept captured buffalo from the Yellowstone Park for harvest and processing. ITBC has provided these services on a very limited funding, and further costs for ITBC participation in buffalo management work groups has been costly, but is critical to ensure a native voice in bison management efforts. Total funding in amount of $500,000 for ITBC administrative efforts will allow ITBC to administer ITBC programs and to be an effective partner with federal agencies. Also, ITBC is requesting $3 million to conduct research to provide scientific evidence of the benefits of buffalo meat for tribal people. ITBC strives to restore buffalo into the diets of Native people for nutrition and disease prevention. It was talked about earlier here, a lot of the talk about our health service and our health needs, and diabetes is is rampant out in Indian country. And with the consumption of buffalo meat, that's what we strive for with the health initiative, is to getting our people back to eating buffalo, and also helps out with the disease that is there rampant in Indian country. However, without scientific evidence of buffalo consumption benefits for tribal people, ITBC has been unable to partner with healthcare providers. They always want the scientific proof. We as Indian people just have that proof, but when you're out working with them on that side, they always want the scientific proof. A summary of our current initiatives, and we have a lot of ongoing initiatives that include technical assistance to tribes, education and outreach to various audiences on buffalo restoration, conservation, and the historical cultural relationship between buffalo and tribes. Participating with federal and state working groups organized to address buffalo issues, creating marketing opportunities for member tribes, and that's what our economics helps out there, providing buffalo to school lunch programs to introduce buffalo to our tribal children. And that's getting our children back at a young age, getting on the right path to eating a healthy meat, and also preventing further diseases from that also. American Indians have long fought to protect traditional food sources. Northwest and Midwest tribes have secured access to fish. Northern natives have secured access to whales. It is time to assist those tribes that relied on buffalo the same opportunity to access and to consume their traditional food source. With that, I thank you for your consideration of ITB's funding requests. An increase in funding will demonstrate congressional support and respect for this national icon. that is so significant to the tribal people. Thank you.
Thank you for your testimony. Next, we'll go to Chairwoman Jones, if we may.
Congressman Cole, Ranking Member McCollum, and members of the committee, good morning. My name is Carrie Jones, and I serve as the tribal chairwoman for the Leech Lake Band of Ojibwe. Our reservation is located in north central Minnesota. I want to thank you once again for holding this hearing to gather information on a number of topics and issues that many of us in this room see on a daily basis. I am deeply humbled by the opportunity to be here, because I know and I have seen that you have not only listed, but have taken significant and bipartisan action on a topic of great importance to our community, improving school campuses and facilities throughout Indian Country. Although my fellow council members are not here today, many of which have testified prior to me, I can assure you that the replacement of the Bugnageeshik High School is very important to each of us. We are working hard together to accomplish this important work and are extremely appreciative of everything this committee has done and will do to assist us with what has been a process filled with many ups and downs. We were thrilled to learn that following the completion of the appropriation process last year, this committee provided additional funding for the construction of new school campuses in Indian Country and additional funding for the planning and construction of school building and campuses. We were further thrilled to learn that the committee and Congress recognizes the serious health and safety threats that exist at BIE facilities across the country, including the Bugnageeshik High School. However, we remain saddened as these serious health and safety concerns still exist as I sit before you today. We were encouraged when we began to see the Department of Interior take action to advance a process for the prioritization of replacement of full school campuses in Indian Country. However, as we went through the extensive application process with many of our state, local, and federal partners, the excitement quickly faded. Despite being encouraged to apply, we eventually learned that Leech Lake was ineligible for this program from the start. We felt a bit misled. With eager anticipation, we await action by the Department of Interior to clarify how they'll address the replacement of facilities like the Bugnageeshik High School, and how and when they'll release funding that is provided for replacement of these types of facilities. Although deeply concerned, we continue to remain vigilant, patient, and hopeful, but cannot help but wonder if our school and our children will ever be provided an opportunity to learn in an environment truly designed for that purpose. As you know, the Bugnageeshik has received significant national attention because the current facility is a metal-clad pole barn originally built to house an auto mechanic and bus garage, not a high school. The facility has severe structural and mechanical deficiencies and lacks proper insulation. It does not meet safety, fire, and security standards. Computers cannot be used at the same time for fear of electrical overload. The structure also jeopardizes the health of the students and faculty due to poor indoor air quality from mold and fungus. The facility suffers from roof leaks, rodents, uneven floors, poor lighting, sewer problems, lack of space, and access for students with disabilities. Students are embarrassed about the condition of the high school, causing a decrease in enrollment. Simply put, this is an important year for the school, as it ultimately can be a make it or break it year as it pertains to its survival. We urge the subcommittee to continue the good work you have started and provide funding to replace school facilities. Further, we appreciate the committee's continued assistance in replacing the Bugnageeshik High School. No amount of Band-Aid improvements repairs will address the serious deficiencies in our high school. We have construction and design plans, but we need your help. How can we expect our children to learn in these conditions? Our children deserve better. I have said this twice before in front of this committee, and I'll say it again. What is clear to me, and I believe to this committee agrees, that this is simply unacceptable. Our students deserve to attend school where they can focus on learning and not their health and safety. The federal government has not upheld its trust responsibilities, and our children are not safe because of it. What more can we do? Miigwech. Thank you.
Thank you very much for your testimony, and we've been joined by Mr. Simpson. Glad to see you, Mike. Glad you're here this morning. Let me just quickly, if I may, President Steele, engage a little bit on this health issue. Number one, thank you for your kind words to the committee, and thank you for your hospitality when we had the opportunity to visit Pine Ridge. It was a terrific visit, quite frankly. I want to make clear from my point of view that this is strictly a tribal decision. The United States government has an obligation here, and it has to fulfill it one way or the other. And I think the tribe gets to choose the way. If you want to use Indian Health Service directly, we've got an obligation to make sure that provides the kind of health care that everybody deserves, because that is a trust obligation of the United States government, no question about it. If you choose to run it yourself, we still have the obligation of funding and working with and what have you. But again, that's a tribal choice, and it will vary by tribe. I know in my case, and in the case of our tribe, we do run ours. We also contract with 8 smaller tribes that are in the situation you talked about, that there simply aren't numerous enough to operate their own facilities.
They do it all together.
Yeah, and that's what we do. And they're part of our governance structure and everything else. But anyway, for what it's worth, it can be done, but you have to decide it's the right fit for you. So with that, let me go to our ranking member for whatever question she'd care to pose.
Well, thank you. And I'm unfamiliar with tribes being able to navigate pulling down funds when the states have decided not to participate in the Medicare. So I'm going to learn some more about that in the next week, and I think some of my other colleagues also have the same question.
Gentlelady,
I'd be happy to yield.
I was going to make the same point, because I'm not familiar with that, and I'm almost wondering, because of course we put the Indian Healthcare Improvement Act as part of Obamacare. Much to my chagrin, but we did.
That's permanent reauthorization.
But, yeah, I'm wondering why tribes wouldn't have the opportunity to contract separately from the state if they chose to. I mean, I think this is a state right, but I don't know why a tribe would automatically, be in that boat. So let's work together and see if we can find an answer on that.
I would like to do that. Mr. Carlson, you're saying that there's no scientific, I thought there was, maybe it's an urban rural legend that buffalo meat's healthier. That's why I eat it. So, but you're saying there's no scientific basis of the Department of Agriculture, the CDC has no guidelines on as to what's more heart healthy?
And I'm going to refer to some of my experts with me too, but no real hard, I guess, but we, as Indian people just have had evidence of families, just sticking to a diet of buffalo meat and reducing diabetes or even completely going away. We had one family do that.
And I just had the honor and privilege of meeting Ms. Hunter from Tonkabar.
Yes.
And where she's from Pine Ridge and tries to buy as much native product, wild cranberries and buffalo as possible. Ms. Jones, I am guardedly optimistic based on a conversation we had with Mr. Roberts when he was here, in which he said, because I want to thank my fellow committee members here. We put some report language in to be very clear that when the Bureau of Indian Affairs was going through looking at what schools to be replaced, facilities that were never intended to be schools or classrooms needed to be red flagged. And we actually heard that loud and clear from Mr. Jones, that they could, I think somebody can correct me if I get this wrong, no one had seen a facility that was being used for a classroom that was in worse shape than Leech Lake at the Bug School. So I'm guardedly optimistic. However, I did say, when can we expect these reports? Because I'm kind of to my wit's end, to put it in a way my grandmother would think is acceptable here, to when we're going to get this list, when we're going to get the report. And then we had a discussion, Chairman Calvert had GAO in, and we had a discussion about how they had literally people out doing drive-by inspections of schools, and how some school facilities hadn't been inspected in 4 years. Minnesota was not on that list. Our schools were all inspected. So it gives me great concern for what else we're going to find out there when we finally get all the inspections done. So I'm guardedly optimistic. The sun comes up every morning, and, I hope it comes up and shines on the bug skull. Thank you, Mr. Chair.
You, Mr. Simpson?
Thanks. I'm sorry I'm late, Chairman Cole, but it's good to see you again, President Steele.
Simpson. Thank you for coming to Pine Ridge.
The Chairman said we appreciated the hospitality that we had at Pine Ridge and the other reservations in South Dakota. We had a very interesting tour out there, to say the least. Opened I think, a lot of members' eyes that were with us to the challenges that we're facing in Indian country. And when we went out and looked at, essentially, you see it on a map, but how big the reservation is and how little law enforcement there actually is.
Sir.
That is a real challenge.
I've got an increase in violent crime and drugs. I have got heroin identified in IHS now.
Yeah.
I need more officers.
Yep, I know, and that was one of the issues that that we were focused on when we were out there. And it seems like we, in our budget, we've tried over the last several years to address the Indian healthcare issue.
Yes, sir.
And we've done that. While I don't want to say ignoring, but that's been our primary focus. And now we're looking at education also and trying to expand that. But law enforcement is obviously one of the areas that we need to also increase also.
It's very difficult to direct our police vehicles, our ambulances, because of the road conditions.
Yeah.
BIA needs road maintenance monies.
Well, you look at how long an officer is on duty.
Yes, sir.
Sometimes. And sometimes, the reservation is so big that sometimes you lost an officer who just got tired, fell asleep at the wheel.
Yes, sir.
Because he'd been on duty so long, and you get a call, and it might be 2 hours to get out to where that call is. If you
He's
get
got
there.
no backup.
Yeah, it's a real challenge. I have seen some of the, I don't want to say studies, but some of the reports from tribes that have gone back to traditional diets and the reduction of diabetes and stuff that's occurred by returning to traditional diets and stuff. And it is, while it might be ancillary sort of stuff, if it works, it works, So I appreciate what you do. It's very important. And I have mixed emotions about fixing the bug school, because I love that name. And if we fix it, we'll probably never hear the name again. So say it one more time. What is it? Buganagishik. Okay. But one thing we did learn on this trip, and at least got a firsthand knowledge of, that we went on a couple of years ago down through Oklahoma and South Dakota, that school construction is a real problem. There are schools that, and I say this, and I don't mean it disrespectfully or anything, but there are schools that we send Indian children to that, frankly, I wouldn't send my pets to. That's how bad a shape they're in. And it's a crime. We need to do something about it, and that's why I think the committee is, since we came back from that, really focused on trying to make sure that we address the backlog in school construction and get those schools up to speed. So anyway, thank you all for being here today. It's good to see you again, and thanks for your testimony.
Mr. Simpson.
Thank all of you for being here. Next up, if we could have, and I hope I get this tonight, Rawanowitz?
If you can't get it right, nobody can.
Oh, come on, yeah. Also, Ms. Lewis, Mr. Isham, and Mr. Carrick, please.
just had to get a bigger piece of paper for my name.
I was gonna say, so exactly.
Yeah, I think it's kind of a little extra. Waranowitz. Waranowitz, yeah. Yeah. Yeah, you were doing really well. Mr. Chairman, before I start, we had a little bit of a civics class in Lac Flamme Public Grade School, in which the kids put together a card for you and the committee in order to take the words that people are saying at this testimony in a good way. Okay. Is this on? Yep. Okay. All right.
So tell me what is that? How does that say it?
Why, Ojibwe Moin is not my forte, but basically it's telling you humbly accept our tobacco. My wife's the Lac Flamme tribal member, and she is the Ojibwe language expert in our family, so, all righty. Well, good morning, and appreciate the time to be able to talk to you about the issues and concerns of the Lac Flamme Band of Lake Superior Chippewa Indians. For the record, my name is Larry Waranowitz. I'm the Natural Resource Director for the Lac Flamme Band of Lake Superior Chippewa Indians. And I am deeply honored that the tribe has allowed me to, talk on their behalf. I mean, that's a big honor when it comes to it. I want to recognize my other tribal leaders that are here. I appreciate the time and going before you. Thank you very much. The President's FY 2017 budget has some important initiatives for the tribes. For example, full funding of contract support costs. That's really neat. I was hoping, because of the treaties, that not only contract support costs, there would be direct costs would be mandatory as well for maybe all Native American programs. So we'd like to be able to make sure that Congress understands that, the court cases, make sure that, contract support is a mandatory thing. I call on you to fully support the administration's emphasis on our youth. That's a big thing in Lac Flamme. We spend a lot of time and effort trying to make sure that our youth, everything they need to have a healthy and secure life. But sometimes that gets very, very difficult in Indian country. So the Generation Indigenous Initiative is the first time this nation has taken a comprehensive approach in improving the lives of Indian children. The administration calls on all agencies, including outside the Department of Interior and IHS, to do their part in fulfilling the trust responsibility to Indian children. Based on the treaty obligations and federal trust responsibility, the federal government should be committed to providing fundamental fairness to tribes, not just in select areas, but across the board. And appropriations for all programs, including Native Americans, should provide funding levels at, based on this fundamental principle. The comprehensive approach asks Congress to support initiatives to increase the number of behavioral health providers focused on Indian youth through Indian healthcare system, as well as increasing social service, tribal court funding to meet the needs and families trying to rebuild a new life in recovery. So we'd really like to have you guys take a look at that. And my written testimony goes into a lot more detail. Education remains the critical investment in the future of our tribes. Our school children attend public schools. For that reason, we strongly support the administration's $18.5 billion request for Johnson O'Malley programs, as well as scholarships and adult education programs. We must do more for our children to pursue better lives through education. We fully support the administration's request of $5.1 billion for Indian Health Service, but I think as all of us sat around this table this morning, it seems like, we still have a lot more work to do when it comes to Indian health. According to the Indian Health, this level of funding would fully fund pay costs, inflation, and partially fund population growth. Just a point, and I wish the Bureau of Indian Affairs would offer that same thing to us, to be quite honest with you. This increase will allow for significant investment in purchased and preferred care with a $48.1 million increase. As we address our community's social needs, we are mindful that the cornerstone for a healthy community is our healthy environment. Clean air, water, and land are vital for the physical and emotional health of our people. They provide for the foundation of our culture and is the basis for unique opportunity within Indian country. Lac du Flambeau has a comprehensive natural resource department and a dedicated staff with expertise in natural resources and land management. So our support for natural resource programs extends to tribal management development programs, all BIA programs, fish hatchery operations and maintenance, forestry, the BIA Circle of Flight program, Great Lakes Restoration Initiative, just to name a few. And we also want to go on record that we support the funding request for the Great Lakes Indian Fish and Wildlife Commission, in which we are a member tribe, and Mick will be providing some information later. Building tribal capacity is vital to ensure tribes have the ability to manage and protect our natural resources. This is why we want and agree with the administration's funding for the GAP program within the EPA's budget. So take that into consideration. One of the areas that we'd like to see the committee take and address is the leaky underground storage tank facility cleanup in Indian country. There was a decrease in funding from $1.6 million from $2.5 million a few years ago. We just feel that there needs to be more of that in Indian country. So we are requesting that the committee try to address that issue by providing $5 million for that program with the EPA. Finally, we urge the committee to add at least $9 million to the BIA roads maintenance program. You heard that a little bit earlier. So with that, I'm going to stop, but I just want to make sure that in Indian country, our lives, our culture, health, education, and welfare are tied so closely to our natural world. Clean air, water, and land are required to maintain healthy, educated communities. That's the bottom line. So please, when you consider the FY17 budget, you take that concept into effect and appreciate the time to speak before you today. Thank you very much.
Thank you for your testimony.
Thank you very much for your time.
Ms. Lewis, you're recognized.
Good morning, Mr. Chairman Calvert, respected members of the committee. My name is Sandra
Oh, could you
Lewis.
hit the microphone? Thank you very much.
Okay. Good morning, Chairman Calvert, respected members of the committee. My name is Sandra Lewis. I'm counselor for the Little River Band of Ottawa Indians. I'm honored to be present at this testimony on behalf of the Little River Band of Ottawa Indians regarding our views and priorities for the fiscal 2017 presidential budget request. Little River Band is pleased with the ongoing commitment of this administration to Indian country. President Obama committed to establish a legacy respecting the sacred relationship forged by our treaties is evident in the appropriations request for the Bureau of Indian Affairs at $2.9 billion and Indian Health Services of $5.2 billion, fully $138 million and $377 million above the fiscal year 2016 enacted levels. The increase demonstrates longstanding commitment to promoting tribal sovereignty, and for the Little River Band of Ottawa Indians, it aligns with our mission to secure and promote the prosperity of future generations. Little River Band of Ottawa Indians would like to thank the committee for hearing the concerns of the tribal leadership and our views regarding the impact of the administration's budget request. Our nation's efforts to reach the outcomes we are all wishing to achieve successful, safer, and prospering First Nations. Little River Band would like to acknowledge the importance of the recently signed MOU between the Census Bureau and the BIA. We believe tribal communities have long been undercounted and inaccurately represented in the census data. We support the $12 million increase to the BIA to address these gaps in Indian country and believe this measure is a key component to formulating a realistic budget. Since reaffirmation in 1994, Little River Band of Ottawa Indians has prioritized its economic development efforts, programs, and services to enhance the standard of living of its members. Assisting Little River Band of Ottawa Indian members to achieve a middle-class economic standard has been an overarching goal since reaffirmation. And while gains are being made, persistent issues remain, as reported in this previous fiscal year. Over half of tribal member households earn less than $30,000 annually, compared to a mean household income of just over $6,000 or $64,500 for Michigan residents. Less than 40% of Little River Band tribal member adults have achieved education beyond a high school diploma, compared to nearly 60% of Michigan adults reporting some degree of higher education. 1/3 of tribal members access one or more tribal assistance programs annually. Currently, enrollment stands at just over 4,200 persons. Little River Band understands the challenges we face to assist the population out of poverty and into true individual self-determination. Little River Band of Ottawa Indians is pleased with the ongoing commitment to make affordable housing available through the Native American Housing Assistance and Self-Determination Act. We have built over 55 high-quality housing opportunities as a result of this act to address the needs of our elders, lower-income, and working families. Little River Band of Ottawa Indians request that the committee continue to make these funds available to us. As our needs are increasing year to year with the return of our people to our homelands, we are presently unmet need of over more than 35 homes in our returning families. Little River Band of Ottawa Indians is also pleased with the increase to health care, specifically the commitment to fully fund contract support costs, which reduces the need to redirect other programs' funds to meet our costs of providing services. Little River Band of Ottawa Indians appreciates the administration's move of contract support costs from discretionary to mandatory appropriations. This change presents an opportunity for the federal government to comply at long last with the decisions in the Cherokee, Arctic Slope, and Rama Supreme Court cases. Little River Band of Ottawa Indians cautions that the proposed proviso limiting carryover is not consistent with the Indian Self-Determination and Education Act and should be eliminated. In addition, the increase to patient service will allow us to continue to implement direct services. We are on schedule to implement a pharmacy service to our members in 2016, a direct result of the service contract support cost increase. Little River Band of Ottawa Indians also notes that funds dedicated to Generation Indigenous will assist us to build stronger programs to address our at-risk youth populations and strengthen our family support systems. You heard when we asked that these types of funds become a formula-based tribally priority allocation, putting all tribes within reach of its need of assistance. Creating government-wide collaborations, placing priority on all of federal government to assist in the preservation of our most precious resource, our Native American youth, is achievable and commendable. There are some areas that are near and dear to me as a counselor, and I wish to bring them to your attention. Language and culture are the cornerstone of the unique identity of Indian peoples. The protection of our way of life is critical to our individual identities and our community prosperity, and most importantly, our children's future. These are guidelines for our governance as nation. The preservation of our sacred lands and objects include the repatriation of our ancestors to our homeland is our highest responsibility. Little River Band would like to see a future appropriations for the Tribal Historic Preservation Officers. The increase will allow the tribes to appropriately staff and, more importantly, continue to provide opportunities for our people to engage in language immersion instruction and culturally based community events that reinforce our identity as Anishinaabeg peoples. The beauty of our culture is found in our language. It guides our daily life, preserves our identity, and provides foundation for the youth in the development of who we are as individual Anishinaabe persons. Our language and culture keeps us strong, drug and alcohol-free, and family-oriented. The budget request of $15 million towards language and cultural preservation is not enough for 566 federally recognized tribes. Little River Band must write a successful grant proposal to even access funds to assist our efforts. A better approach to ensuring the preservation of unique language, culture, sacred lands, and objects that make us who we are. would be to implement a government-wide initiative similar to Generation Indigenous. Can I go on? My time's up.
About 30 seconds.
All right. All right, and
3 minutes over now.
okay, sorry about that. And I just basically wanted to talk about our ricing program and how important that is to have our natural foods back in our community and our roads. Just to touch base on our roads that, they're gravel. We need help. And I just want to say miigwech. Thank you for your time and the way my gun.
Well, thank you, and your full testimony will be in the record, so thank you very much, absolutely. Mr. Carrick, you're recognized.
Thank you. Mr. Chairman, members of the committee, thank you for having us today. Appreciate the opportunity to speak today. My name is Levi Carrick, and I appear here today on behalf of the Chippewa-Ottawa Resource Authority. All right, thank you.
Wife's not here today to help.
Yeah. Well, I'm in trouble thanks to him from last night.
It's been a rough week for him.
Okay, well, CORA is an intertribal resource management organization that is established by the 5 tribes in Michigan that signed the Treaty of March 28th of 1836. This treaty reserved the right to hunt, fish, gather on the lands and waters that were ceded to the United States. And this encompasses approximately 2/3 of the land in the state of Michigan and a large portion of the Great Lakes, Superior, Michigan, and Huron. I'm also president of the Bay Mills Indian Community, which is one of the tribes that make up CORA. I requested the opportunity to testify personally today to express CORA's appreciation for the rights protection implementation or RPI funding that is in a request for CORA that is contained in the President's 2017 budget for the Department of the Interior. The RPI program funds enables CORA tribes and their members to exercise the reserved right to manage, hunt, fish, trap, and gather on the lands and waters that were ceded. But there is one line item in there in the proposed budget for 17. It's listed as Intertribal Resource Management Organizations, Evaluation and Research Activities, Climate Change. CORA supports the administration's proposed $2.5 million increase for the climate change activities, but it does not support the administration's proposed competitive process for distributing these increases. Because forcing the tribes to compete for climate change funds is a direct contradiction to the trust relationship underlying the RPI funding. I testified last year that the tribes need to have the ability to be proactive rather than reactive to our environmental changes. Making the funding process competitive makes it much more difficult to be proactive because we just can't plan, things are changing continuously. So protecting the resource should never be a competitive basis. CORA instead supports the allocation of those funds among the intertribal organizations based on the percentage that each organization will receive in the RPI funds, as compared to the total amount requested in all RPI proposals for 17. This is the same method that was used in previous fiscal years, and it seemed to work well. We can live with that. CORA leaders and tribal biologists have, over the last 35 years, been key contributors to interagency management committees to deal with our environment out there. Tribal biologists working individually and collaboratively with others have significantly contributed to our scientific knowledge of the Great Lakes and the natural resources involved. Tribal conservation officers and biologists work to ensure the sustainable use of the natural resources in an area of more than 13.5 million acres of land and large portions of the Great Lakes. Whether on the Great Lakes or inland, tribal CEOs and biologists and their leaders will continue to be at the forefront as we all deal with new challenges brought on by climate change, invasive species, or any of the other factors that might change the ecology of the region or threaten our culture. CORA provides an intertribal voice to coordinate and cooperate with the agencies of the United States, the adjoining states, and the province of Ontario to manage our natural resources to the 7th generation and beyond. For this reason, CORA significantly respectfully request that you support the 17 RPI funding at the level in recurring base funding, which is the amount outlined for Cora in the RPI program under the Department of Interior's Green Book for 17, plus Cora's proportionate share of the climate change line items. Thank you.
Thank you very much for your testimony. And is it Isham?
Isham.
Isham. Mr. Isham, you're recognized. Good
Although
to have
the
you.
nuns used to call me Isham, and I never corrected them, so.
Better set that to 10 minutes now then.
Get comfortable. Chairman Cole, members of the committee, good morning. My name is Mick Isham. I am currently the chairman of the Lakota Band of Lake Superior Chippewa Indians in what is now known as Wisconsin. And I'm also serving as the chairman of the Great Lakes Indian Fish and Wildlife Commission. And on behalf of the Great Lakes Indian Fish and Wildlife Commission and our 11-member tribes and our 40,000 plus citizens, tribal citizens, I want to thank you for over 30 years of support for our treaty reserved rights. With your support of the Rights Protection Implementation line item, we've been able to effectively co-manage the natural resources in over 60,000 acres of our ancestral homeland where we continue to hunt, fish, and gather, just as we have for 1,000 or more years, thousands of years. This homeland is located in the top third of what is now known as Michigan, Minnesota, and Wisconsin, and I think we provided you all with one of these packets. And, you know, as I listen today to all the other tribes and their tribal testimonies, I've heard many of the same issues that we're dealing with back home. Health issues like diabetes, obesity, youth violence, gangs, drugs, and, you know, I'm hard-pressed to find any communities, Indian or non-Indian, that aren't dealing with those types of issues. And we have conventional strategies to deal with these issues, like police and our health centers and education, sports. But one initiative that's having a positive impact is our intensive focus on getting our youth involved in exercising their treaty reserved rights. At all our feasts, ceremonies, and funerals, we are required to have 4 foods. There's fish, venison, wild rice, and berries. And our initiative is to instill in our youth their cultural identity. Now, it sounds simple, but in an era of MTV and video games and all that stuff, it's actually pretty hard. You know, when a kid is identified by their elders as the one who's fulfilling that cultural need, the one who's providing that rice and fish, that's a real powerful thing. We have a word for that. It's called Gauyo Seid, means the provider, one who provides. And when the elders are referring to an individual as that, it is extremely powerful. It instills a pride like no other. So this identity, we believe, can effectively compete with fulfilling their need to get their identity. With some kids fulfill that through going to a gang. It also has a couple of other benefits like you've been talking about today. It gets the kids off the couch and away from those video games. And it takes intensive physical activity to engage in these treaty harvests. It's physically taxing to go out and get wild rice and harvest it all the way through. Finally, get some activity. And that same treaty rights focus has also another benefit to our people. The increased emphasis on traditional foods, as the gentleman before us here was talking about. We want to replace today's high-fat, processed, fast food diet with a much more healthier traditional diet, and that'll help us reduce obesity and diabetes, and there is scientific data on that, and we've ourselves have been working on also doing our own studies on that. So while many would look at this type of funding as just funding a natural resource agency or a natural resource program, we see it as so much more. And so we are asking again that you support this funding request, and With my remaining half hour, I'd like to touch on the GLRI if possible, and that we support that in our written testimony, but I'm really hoping that we can tweak the way that the EPA administers this program a little bit. The way it is now, the EPA determines priorities, and then the tribes have to try to fit into that. And you all know that each tribe is unique and different, and we can't always fit into those priorities. All our priorities are different. And so hopefully we can work on a program where there's a tribal set-aside and we can run our own program. So again, I want to thank you for your time, and I want to also thank all the other tribes that are doing their testimony, because I hear so many of the same issues: police, roads, BIE, schools, everything. So again, Miigwech, thank you.
Thank you very much for your testimony. And let me start just quickly. I want to make a point. I know a couple of you, I think Ms. Lewis and Mr. excuse me, Larry. How you doing, Larry? Both mentioned the administration proposal on Generation Indigenous. And that's actually mostly funded in the Labor, Health, and Human Services budget, which I chair. The administration began, much to their credit, last year to put more emphasis on Native youth, and we pretty much fully funded them, and I suspect we will again. We think that's a very good initiative, wonderful legacy for the president. And also, just to put a plug for this committee, for 4 or 5 years in a row, it actually put more money in Indian health and the BIA than the president asked for. And that's no criticism of the president, because he certainly was asking for increases. But we know there's been a lot left undone, and there's a lot of the trust responsibility that has not been met. And we all wish we could wave a wand and fix it in a year. Can't do that, but we've been able to at least put it on the right course. A number of you mentioned the progress we'd made in healthcare in some areas, the deficiencies we've got in others. Just so you know, not only have we had a major increase, but you can, on the one hand, you can say, gosh, 50%, and so that's really pretty good. But if you looked at it on per person, Indians get fewer dollars spent on their health care than anybody else in the country by a long shot. I mean, a couple of years ago, and I think the numbers haven't changed all that much, the average American got about $6,900 worth of health care a year. The average Medicare recipient about $11,000. The average veteran about $7,800. The average prisoner federal prisoner about $5,200. The average Native American about $2,700. So that's how far back we have fallen in terms of providing adequate health care. So we're doing everything we know, both in terms of pushing up the federal budget and working in some of these innovative programs. I don't know if you were here early enough to hear Chief Baker of the Cherokee Nation talk about the joint venture effort, where basically they're an affluent tribe or a big tribe. They're building the facility, and then we staff it and operate it. Lets us leverage the dollars a little bit. Now, not every tribe can do that, and it's our obligation, but we are trying to find some creative ways to close that gap down a little bit more. But it helps when you travel and educate the committee. So thank you for taking the time to come, and certainly helps our staff as well, because there's nothing like eye to eye, get the testimony and actually visit with people about these things. It's extremely helpful, not only for your own individual tribes, but as Mr. Isham said, when you hear it over and over again from tribe after tribe after tribe, it drives it, but it shows you where the common deficiencies are, where the common challenges are. And again, this has been an area you hear a lot about how divided we are in Washington, D.C., and we certainly are, and it's an election year sometimes, but not on this. This committee has worked really well under Democratic chairman and Republican chairman. My friend Mr. Simpson was one of those chairmen. And our friend Mr. Calvert, who is only not here because he literally has national security work that he's involved in, and he had to leave last night. But their predecessors, Mr. Moran, Mr. Dix, both Democrats, exactly the same way. This journey is started, and we're pretty determined to keep moving the ball forward, both in this subcommittee, and I can tell you in the Labor, Health, and Human Services, I think we actually increased the pot of money that goes to the variety of Indian programs by about 40% last year. It was a big increase, but again, it was an increase to the administration's credit they asked for. They came and made a very good case, and so anyway, we will try to continue to work with you. I went on a little long, but I'm going to call on my friend, the ranking member, to offer observations or ask questions.
It was all good, Chairman Cole, because you took care of the health care, and so I can focus on the environment. So this is great. I want to just, for the record, talk about the work environmentally that you're doing with the dollars and tribal dollars and leveraging state dollars and university dollars, whether it's in Red Lake, Mille Lacs, Leech Lake, what's going on with our walleye population. Fond du Lac with what is going on with moose, which we're finding out that we really didn't study. And the moose population is very, very fragile right now. Climate change playing a role in that, as well as invasive species, whether it's milfoiled or zebra mussels that we're dealing with, the pine beetle, Asian ash borer. I mean, I could go on and on and on. So I kind of set that up because I just want you to take a minute and talk about how we can do a better job in consultation, because you both, you've all touched on it in different ways. And one of the things that I've been making sure, and I give kudos to my governor, Governor Dayton, for stepping up to do better consultation, as the discussion was going on about mining, sulfite mining, and our water systems are really, really interconnected in the Great Lakes area. Our water basin is, and making sure that we first do no harm. So I know that you have where you'd like to see us talk a little bit more about protection rather than always having to go to restoration. And if maybe you could just take a minute amongst whoever wants to kind of kick it off. I'm not going to pick favorites here.
I'm going to press the button
Oh,
first
the Green
here.
Bay Packer guy went first. Come on, guys. Help a Viking fan out.
Well, I don't want to mention anyone on my wide left here. Sorry about that. Okay, let me focus back on the question here. Well, you mentioned how you can do better at consultation. One thing is that it's important that tribes be in the room. I talked earlier about how EPA develops the priorities and then we have to fit into them. I think the tribes got to be involved more at the beginning level or at the top level instead of trying to, as Jim says, they develop the hole and the peg, and then we have to force fit it in there. And so I think that's a real important issue that we're involved because we are so uniquely different. You mentioned a bunch of different invasive species, and some tribes are fishermen and women, some tribes are wild rice people, some tribes hunt moose, and we're just all so different that each program should be uniquely crafted by the tribes themselves instead of EPA deciding that. And so that's one anyway. And also, while I have the mic here, I want to thank everyone for their support of you mentioned Bug-O-Nagesic earlier, the staff and, our kids at Waduka Dotting School got to sing for the president. I don't know if any of you were there at the White House Summit, but they didn't do the Hail to the Chief like they usually did. Kids from my Waduka Dotting School got to drum and sing for the president. And that program that we have, our school was saved. And so, I want to put in a word for Bug-O-Nagesic too, but it's through these programs and getting those kids at that age involved in the culture and the treaty rights that then can help solve a lot of the problems that we talked about today. That's my half hour.
It was well said. Mr. Simpson.
That is well said. Just one question. It's the first time I've ever really heard in the hours and hours and hours that we've sat over the years, underground storage tanks, leaking underground storage tanks. I know. That's why I didn't say it. I didn't know that that was an issue on reservations, that it's a problem. And I used to know this, and Betty probably knows this stuff better than I do. But I used to know it at one time, but I'm getting old. How is that fund funded? Is there a special tax that goes in to fund that?
PECFA.
Yeah, it's a petroleum.
That just goes into the EPA, into the underground storage tank fund or the leaking fund or whatever you want to call it, lust fund, I guess.
It'll get better funded.
Yeah, but it just goes into that and then it's appropriated out?
To states.
To the states. And then sometimes the states will also, when I was in the Minnesota State House, we clicked on a little more because we wanted to try to knock out as many as we could.
Yeah,
But
we
we'll-
had a tax in Idaho on a transfer fee tax, but our courts ruled that unconstitutional, but it went into that also at one time.
So when we were in excuse me, Mr. Chair, when we were in Navajo Nation, I have a picture of it. It was a building with a lot of graffiti in that, and it was an abandoned gas station, and I was asking about the lust funds there, and the tribal leaders were saying that by the time it gets distributed and gets down to the reservations, they don't see any of it. Larry, you have some more statistics in here, maybe there's something you want to add.
I was reading those statistics.
Yeah, I mean, I think that in one time within Indian country, there was 1,300 plus sites that were identified. And a lot of them were cleaned up, and I think there's 298 of those sites that still need some work. But what we're afraid of is that 1,375 sites doesn't really indicate how many are there. Yeah. And even just to go ahead and fix the 298 that are identified, you need a good amount of dollars to do that. And what happens a lot of time, like in checkerboard reservations where you have, tribal and allotted lands and fee land status, the state of Wisconsin, for example, would come in and deal with the ones that are on non-Indian land. So they may not be included in that 1,375 that are associated with identified in Indian country. And we have 25 of those sites on the reservation that were closed by using state funds, PECFA, and one of them in particular, the Haskell Lake, Tower Lake Standard, was closed under state statutes, and we found out later that it had still 9,100 parts per million benzene and lead concentration, stuff like that, and we're trying to work with the state, EPA, and the BIA and us to try to get it cleaned up.
But there is no requirement that part of the fund to go to reservations or Native American tribes or anything for cleanup. It's just at the discretion of.
Right. Sometimes we had to get that funding through headquarters EPA in order to deal with it. And I think there's 1.69 million. Our particular site is a small site, and it's about $250,000 to $300,000 just to get it cleaned.
Okay.
So
Mr. Chairman,
there's
this is an example of why I think it's important to tribes to be able to, like under GLRI, run their own program, because under the way Lac-Courte dealt with this issue is through the EPA GAP program, where each tribe has, this set aside, and we develop our own unique programs. We dealt with all our underground storage tanks as a priority early on, and we have taken care of all of our underground storage tank issues.
Tribal land?
And so it's an example of how, when you run your own program, you can tailor it to yourself, and that's how we used our GAP funds. Now we switched priority.
Thank you.
Thank you.
Well, thank you very much. We appreciate it, and you've educated us yet again, so we appreciate it very much. If we could, for our last panel of the morning, I know we're running a little late, so thank all of you. Thank you for your indulgence. Mr. Miller, Ms. Cornell, and Ms. Martin.
Mr. Cole?
Hey, thank you very much.
unless
Is Sarah not here?
Sarah's invisible.
Okay. Well, we'll go ahead if we can and get started.
She's coming.
Oh. Yeah, did a good job. Good morning. Welcome. It's good to have all of you here, and thank you for traveling all this distance to give some testimony. Mr. Miller, you're recognized for 5 minutes.
Good morning, Chairman Cole and committee members. I'm the president of the Association of Community Tribal Schools, and we represent a number of schools in the BIE-funded system. First off, I'd like to thank you for the FY16 appropriations, drastically needed. I'll get right into the testimony in order to speed up here, is that if you look at our testimony, you can see by our charts that we are in a perpetual state of catch-up. I have been in the administrator at the Hannahville Indian School, so I work in the product that I'm talking about, the schools and the students. We have a need of having an increase at least to our 5 major areas, categories within the BIE appropriations of the ISEP formula. We need a 2 to 3% increase. We need a 2 to 3% increase in student transportation. We need that in operations maintenance, and then the grant support cost. Recently, and I noticed that some of the conversation today was on facilities, which is one of our biggest areas. The GAO report on the health and safety kind of reinforces what we're talking about. The school that was mentioned today, Buganagijic, very familiar with the school, worked with it closely for 30-some years. In drastic need of replacement. The conditions that some of our schools are in, we needed the increase in O&M not only to increase what the condition is, but just to hold harmless. We have a problem here. When we're given operation and maintenance dollars that are not enough in the first place, we end up with a cycle. We take an old building, we try to maintain that building, and we end up with an old building maintained. That's the cycle here that we're in. What we'd like to do and what needs to be done here is that there needs to be first off, fully funding on the formula amounts. It's kind of strange to me as a school administrator, when you use a formula amount and you never fund it. I mean, the formula does you some good, but really not a lot when we've been in the operation and maintenance areas with 50% constrainment. Now that, to me, is totally, I don't know, I can't fathom exactly why they do that, but that has happened to us. One of the things I think, besides the 2 to 3% yearly increase in those 5 major areas we have, we need to get construction, and it's got to be some common sense. I went through with Roger Bordeaux, from the executive director of the association, we went through the facility condition index of all of the schools. If you take that there are 60 that need to be replaced, they're in deplorable conditions, here's the reality of the situation. If you fund 5 a year, and it takes 3 to 6 years to build it, we're going to be in a different century before that last school is done. So that's the problem we have, and when you look at it from a real, frank situation here, is that there has to be something done to bring those schools that have asbestos, their schools were built in the 30s, 50s even, are today is 60 years old. But we need to get those things addressed, and we need to get them addressed quickly. I'm in my last year as an administrator at the Hannahville School. I retire. I'm not going to get out of this entirely, but the fact is that I'm singing the same song 3 decades later. I started in 80 testifying, and I'm doing the same thing again today. The hair's changed a little bit, but so I guess what I'm trying to get across here is that we need to seriously work at increasing, of course, our first 5 areas, but in addition to that, and the operation and maintenance, which is critical, we need to get some real movement on facility replacement. And it's going to be a sting. We've talked about operation and maintenance. We could do that part by either fully funding the formula or, in addition with that, forward funding the formula a year. Kind of taking it out of the political game here for a while. But we need to do things like that. And I've been at this long enough now. I've been through systems. GAO kind of refers to. FATCOM started back in 1980. FEMAS came in. Now we're in Maximo. I still haven't figured Maximo out. I will eventually, but I haven't figured it out yet. But those things were never fully implemented. It's kind of like we're always up here kind of referring to the same things, but it's because the same things keep happening. And I don't know this thing about doing the same thing and coming out with a different result. It doesn't normally happen. We're trying to get some change here, and I think with a expectation that we can increase 2 to 3%, we're going to catch up. It's going to take a long time. Maybe we never will catch a national average. I don't know. But in the operation and maintenance and the facilities, we have to do something here. These schools, like the ones that have visited, and those of you who have know what the condition there is, you wouldn't send your kids to them. These kids go there because they have to. So I think that our overall intent is just to provide our students with a safe and healthy learning environment. We do that, I'll retire a happy person. Yes, I would. Thank you.
Thank you for your testimony. Ms. Cornwell, you're recognized for 5 minutes.
Good morning, Ann McGuitch. Thank you, Chairman Cole, Ranking Member McCollum, and Congressman Simpson. Thank you for allowing me the opportunity. I have submitted my testimony for the record and would just like to take this opportunity to highlight a few of the points. Nawakamagukwe, Bidishbikewe, Bidanakwe, and Indigenous St. Croix Chippewa Indians of Wisconsin, and Dunjaba. My name is Sarah Taylor Cormel, and I'm the Secretary of Health and Human Services for the St. Croix Chippewa Indians of Wisconsin. We are spread out over a 5-county area in northwest Wisconsin. We border Minnesota border, and we also have a small tribal community in the eastern side of Minnesota, and we share that service area with Mille Lacs. What ends up happening is we are competing for funds in Wisconsin and in Minnesota. And this competition for funds is the form of area office funds that are allocated, and usually allocated at only 60%. Last year, as I stated in my testimony, we had already made cuts, layoffs, because we've had continuous growth over the past 5 years under my leadership and substantial growth prior to my administration. However, because funding doesn't keep up with that growth, we are faced with, do we make cuts with services or do we make cuts with hours? Because we want our community members to depend on the services as with any medical home or human service, we're looking at sustainability of that growth, which is not possible with the allocations that we receive. Last year, during budget allocations, prior to negotiations, I contacted our area office and contacted BIA, BIE to find out how do we increase funds? How do we make sure that we have more funds based on patient counts? And when I start talking about patient counts, some of the system responses are, well, there's no guarantee there'll be more money. And it's almost automatic, and it's like, okay, and that's fine, but what do we use as a formula? How do we find out are we at the highest allocation fund? Well, and if there's more money given to us, somebody else had a decrease, because it's a finite pool within each of the areas. And that's every federal funding force, whether it's IHS, BIA, BIE, block grants, you name it. Bottom line is, we are pitted against one another to compete for funds to provide the services. And although we'll go through those processes, and I thank you for your testimony, it's not just in one area, it's across the board. In addition to not having the funds adequate to not only sustain growth, but to grow, we also have sequestration. And you're making across-the-board cuts for there. Or, in addition to that, trying to find out how do we float, because it was a continuing resolution for 1.67 while the agreed-upon budget is waiting to be allocated. This year alone, we ended up laying off several employees, and I had to sit and pick, what can I tell my council about what's an appropriate cut? Where can we say, we don't need this service for our community members? What's reasonable? And in my mind, what I tell my staff when I'm talking about morale, nothing's reasonable. We worked hard to get where we are. We need these services, and we need to be able to provide them consistently. However, when you're chronically underfunded, that is a challenge. And then, when you only receive 38% of your funding into 6 months of your fiscal year, you're trying to figure out, okay, how do we make payroll this week? And please don't share that with the staff. That's where we get, and that's the reality. So when I go to these meetings, whether it's masked or I was here for budget negotiations at the federal level with DHS, and we talk about the underfunding, and we talk about the progress, and there's been progress. I'm a child of Indian Health Service. I grew up at LCO, that's how I know Mick. But I also have my master's in social work from UW-Madison, and I was determined to make a difference with our people. And in order to do that, I need more. We need more funding. We need a fair assessment of what is allocated now. What is that determination? A clear answer to tribes. How do we do the allocation? What I didn't submit, but I could submit if you'd like for the record, I can get a copy to you. These are the formulas. And price variation, 28% purchase, price index, benchmark, exclusions of wraparound, percentage depreciation, balance of area shares. It's 4-step allocation process. Now, my father-in-law is a rocket scientist, but your health directors and administrators shouldn't have to be. Your tribe shouldn't have to be. So assessing what calculations are utilized, are they contemporary? Are they meeting the need? Is it a true assessment of need, or is it an incremental percentage increase based on historical numbers? Sequestration, it needs to go away. Funding allocations have to be mandated. This is a trust obligation, and I appreciate the efforts that have been made to get us closer to that step. And at negotiations, they talked about that a portion will be. It needs to be across the board. It's a trust obligation. The monies need to be there and reliably deposited in the account, not a reimbursement program. So I thank you for this time. Miigwech.
Thank you very much for your testimony. Ms. Martin, you're recognized for 5 minutes.
I realize I'm the only thing standing between everybody and lunch, so I'll try to make it quick. I'll fight against my lawyer self. Good morning, everyone. My name's Aureen Martin, and I'm a member of the Bad River Band of Lake Superior, Chippewa. I'm here representing the National Indian Child Welfare Association today, and I think you're all pretty familiar with them. Our mission at NICWA is twofold. First, it is to address issues of child abuse and neglect through training, research, policy development, and community development. Our other mission is to support compliance with the Indian Child Welfare Act. On behalf of NICWA, I'd like to thank you for the opportunity to come today, and also thank you for all your efforts to increase funding for child welfare programs over the last few years. We know you've done an outstanding job over and above what's been asked of you by the administration. My written testimony contains our requests and support for several programs that we've talked about over the last several years. But today I just really want to concentrate on one set of programs, and those are the BIA's Indian Child Welfare Act program and funding associated with that. When the Indian Child Welfare Act was passed in 1978, it was also the first time that funding was authorized directly to tribes for child welfare services. And when tribes started receiving that funding, the purpose and intent was that they would have an adequate amount of funding to provide basic child welfare services. Now, unfortunately, over time, that funding has decreased in actual real dollars to the point now where there are several tribes that only get $25,000 a year to run Indian Child Welfare Act programs. That's not even enough to hire a staff person full-time. But at the same time, these programs have begun seeing tremendous pressure on them. We know that, or we estimate that over 2% of children in state and tribal, all child welfare systems, and that population are Native American. But tribes and tribal programs receive less than 1% of overall funding for child welfare services. At the same time that we're dealing with child welfare services on the reservation, states, and this is a good thing, but it's also a stressor, states are asking tribes for help to provide culturally based services to help prevent foster care placements or to make them shorter. And then the third area, which has seen a tremendous increase over the last few years, is litigation on Indian Child Welfare Act issues. We had the Baby Veronica case in the Supreme Court, but since then, anti-ICWA groups have engaged in a systematic effort to litigate across the country against the Indian Child Welfare Act. And at the same time, another good thing is that the BIA has stepped up and they've been pursuing regulations that would increase enforcement of the Indian Child Welfare Act. But all of these things are pressures on Indian Child Welfare Act programs. So it's our recommendation that you've done a fantastic job with increasing amounts in these programs, but we're also recommending increases above that. From $15.6 million to $18.9 million for FY 2017 for the on-reservation program. We're also asking that you consider funding the off-reservation BIA ICWA program because it had been funded and now it's defunded. When it was funded, it provided funding for up to 30 urban programs to provide child welfare services. In the 2010 census, the Bureau of Census actually estimates that over 67% of Native Americans live off the reservation, many of them in urban areas. And that's a huge gap then in child welfare services. So we believe that that is an appropriate way to use funds, and we would suggest and ask that you do that. Child welfare, I owe in my own personal life everything to the ICWA program. It provided me with my first job, but also has provided me with my family, so I can't stress enough how important it is to me personally, but Indian people across the board. And I'm going to give you some time back. If you have any questions, I'm happy to answer them.
Thank you very much, and go to the ranking member.
Well, thank you, Mr. Chairman. I think one of the things that, especially when it comes to health care and even, knowing that teachers are going to be paid to show up to work, beyond sequestration, we all try to get our job done on time. Our chairman, Mr. Rogers, is very persistent. He's very hopeful every time we start a meeting that we're going to do everything in regular order. I know Ranking Member Lowy agrees with that. But if they just let, I think, the Appropriations Committee do its will, we would get things done. So forward funding is becoming quite something that I'm hearing over and over again. We did that for the VA because we didn't want to leave our veterans without health care. We shouldn't leave anyone in this country without health care. So I think forward funding is something that won't happen this go-around, but I hope that the next president, whoever he or she is, talks about doing that, and I hope that that's something that we can start talking within our respective caucuses and get some not bipartisan, nonpartisan support for. The schools, I'm going to ask again when we're going to get the list for facility as well as campus replacement. We're getting ready to do our markup. And Mr. Simpson, I was telling people how you with your Fitbit, me with my Jawbone, both did 500 steps in the school bus. So thank you for your charts. I think they're going to be very, very helpful. But if I could, Miss Martin, I was at Red Lake, it's about a half a year now, and talking to the chairman and the tribal council there. They're out-of-home replacement placements because of what they're dealing with, and they're trying to put a whole of nation wellness plan together. It was just staggering. It was like 60%. And they know that everything has to be working in a child's life, so they're really taking a whole of nation approach with little or no support or help. And part of what came up was the funding that they had for their children for doing what they needed to do. this to me, in some tribal areas, I think tribes are saying it's a crisis. Can you explain to me why there would be backlash? I mean, I know why, but I'd like you to put it on the record. Why there's backlash for trying to do what's right in keeping families whole and keeping children in a, we need to make sure they're in a safe situation, but working to keep children with their parents, with their family, with their tribal enrolled members.
Well, I think that's a complicated question or answer. I think there are really two things. I think with ICWA, with regard to voluntary placements, I think that adoption forces see that as an opportunity to be able to find a pool of children that can be adopted that currently can't be. But I think that there are basic cultural misunderstandings which actually led to the original passage of ICWA, which is that we as tribes see ourselves as a whole community, as you said, and our families as a whole community that can care for a child. And so if a child is in a situation where maybe they don't have everything they need materially or from specific care from their parents, your whole family, your whole community looks out for you. But the outside just sees that one unit and they don't see anything else. And so I think culturally they view the need to place children out of the home or out of that area more often than we might otherwise see that in our own community, because we can see that whole. Funding is always also an issue. There's always a competition to get that funding, and then, as you said, there's a finite pool of money, so there's always going to be a fight over whether the states get an allocation and whether some of that should go to the tribes or not. And then I think the last thing that's a challenge is how to get funding for things like foster care. We don't really provide that through the interior budget, but Title IV-E program does provide that. Tribes have had difficulty accessing those funds because it's very complicated. I think we're seeing more and more tribes do that, but it has been difficult.
Thank you. Mr. Simpson?
Probably no questions, but Tom, thank you for 30 years of testimony. We hope within the next 30 years we can solve some of these problems. No, they don't go unheeded. I think you probably see a more understanding Congress of the challenges facing Indian country and the desire to try to help, even though we probably haven't gone as far as we should. I mean, obviously we haven't gone as far as we should in some, but we're attempting to. A lot of that's due to the efforts that you all make. A lot of it's due to Chairman Cole, frankly, and his work within Congress and getting other members of Congress to understand that we do have some responsibilities, some trust responsibilities, and they're not, as it says on the thing, they're not discretionary. Forward funding, I think we put pressure on to make forward funding happen for a lot of different agencies because we've been unable to do our job, as Ranking Member McCollum said. It's been 1994 since we actually did our appropriation bills on time and got them done by October 1st. And, there's a lot of things I'm uncertain about, but one of them I'm fairly certain about is when October 1st comes, and you'd think we'd be able to do our job and get it done on time. And I would think if they left it up to the Appropriations Committee, we could actually do that. But politics enters it, and that's unfortunate. But the challenge, as you well know, with forward funding is we have to find 2 years of funding in 1 year to do it. And when you have restrained budgets to do that, it's tough to find this year's funding and then next year's funding also so that we can forward fund it. And that, apparently we did that with Veterans Affairs, but almost every federal agency would like to be forward funded. And to a large degree, it makes sense in that you could plan better, all of that type of stuff. That's why I think, frankly, we ought to go to 2-year budgeting. And then annual appropriations and just make sure we get them done on time. I thought we were going to have a good year this year where I thought if there's any year we're going to be done by October 1st, it'll be this year because we got the number from last year. So we knew starting off what we were going to do. And Speaker Ryan tried to move the process up and get it done quicker so that we'd get all the individual bills done. Now we're having a fight over the budget on the number that we agreed to last year. So, that's the way the political system works. But I want you to know that your testimony is heard. and we appreciate it very much, and thank you all for the work you do. And this committee, both Republican and Democrat, understands the importance of our responsibilities in trying to take care of these issues. Thank you.
I want to build on that, and then we'll close out pretty quickly, but I want to thank all three of you, obviously, for the work that you do and for taking your time to come and testify. I know sometimes it seems like the labor of Sisyphus. He keep pushing the rock up the hill, and it rolls over you on the way back down. But, you know, it has made a difference. You know, it's not, none of us are where any of us would want to be, but I can look at funding lines and totals and just awareness, and certainly where this committee is concerned, and not just the subcommittee, but I think broadly the committee, we've made a lot of progress in the last few years. And that is, as my good friend Chairman Simpson said, largely due to you guys talking to other people. Your biggest single problem here, I mean, why you can get veterans funded forward is because there's veterans living in every congressional district in America. We don't have an organized tribal presence in every, and so many members, including very good members who I've seen really learn a lot over their time here, but they come here with no tribal representation in their districts. They don't know very much about the issues. They really don't. You know, when we had this little chart made up a couple of years ago, which then Director Rubido did for us with the comparison on the funding, we had a great member of this committee who had gone to one of our chairmen and wondered why do the Indians need all this help? They get all this free health care anyway. He had no idea what the disparity in the dollars were, and that was an excellent member. I said that with no disparagement. He just didn't know, and so your work, when you reach beyond those of us that are on your side, is really invaluable. It really matters, you know, I always tell people that one of the great victories I ever saw up here was on VAWA, where we had this amazing group. We had unity from a tribal perspective, and then you had these extraordinary Indian women up here, literally going office to office with some amazing and touching and frankly heartbreaking stories, and we got something done on that. Now we still don't have it funded. We got lots of problems, but it was a big tribal sovereignty win. I would tell you again, we are making some progress, and it's largely due to your efforts. So keep at it, and I guarantee you this committee will do everything it can, both in terms of Native American issues, but more broadly, appropriators. We'd like to see the system work. And, you know, I've never met a liberal or conservative appropriator who didn't care about process, trying to move this stuff along on time, trying not to politicize it, trying to recognize that there's a place to have policy fights. But we do have a lot of people that seem to want to use us in that way. So, anyway, this concludes this morning's public witness hearing regarding the fiscal year 2017 budget for American Indian and Alaska Native programs under the jurisdiction of the Interior and Environment Appropriations Subcommittee. I want to thank all of you and the distinguished tribal elders and leaders who were testified today or sat in the audience. Today's hearings are just the start of a dialogue we've come to depend upon to help us make difficult choices in the budget and earn the votes of our colleagues. Please feel free to reach out to the subcommittee in the days and weeks ahead as we work to address the many valid concerns we've heard today. Hearing's now adjourned. We're going to have another one of these at 1 o'clock. So if you want to have lunch and come back and watch us do this again, you're welcome to do so.
Thank you all.